Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan, sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peranan penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sultra terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, Beski, Bank Sultra Kris, melalui aplikasi Bank Sultra Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Beski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sultra, urusan beres, liburan pun jadi lebih nyaman. Beski gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Sultra, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan, buat Beski jadi lebih pede. Mau kuliah Kulineran, Besti nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi, bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman, gak perlu bawa uang cash, tinggal scan dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman, pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup gandeng keranjang saja, jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Soka melalui Bank Soka Mobile. Dari Bank Soka, maju bersama.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi selain lingkungan, makanan, usia, gen memegang peranan penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Songka terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru BSI Bank Songka Kris melalui aplikasi Bank Songka Mobile. Kini ada cara yang lebih mudah liburan bareng teman. BSI gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Songka, urusan beres, liburan pun jadi lebih nyaman. BSI gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Songka, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan, buat BSI jadi lebih pede. Mau kulineran? BSI nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja? Cukup nenteng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Songka melalui Bank Songka Mobile. Dari Bank Songka, maju bersama.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit, bahkan kanker. Mengapa demikian? Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan, sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peranan penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sentral terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, BESKI, Bank Sentral Kris, melalui aplikasi Bank Sentral Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Beski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sentral, urusan das liburan pun jadi lebih nyaman. Beski gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Sentral, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan BESKI jadi lebih pede. Mau kulineran? BESKI nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup dandang keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sentral melalui Bank Sentral Mobile. Dari Bank Sentral, maju bersama.
Well, ladies and gentlemen, may I have your attention, please? Our ceremony will begin. Please have a nice seat and settle in your good position. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, Salam Kebajikan, and good morning to everyone. Yang terhormat, Badan Penyelenggara dan Dewan Pakar Yayasan Mandala Waluya Kota Kendari. Yang terhormat, Rektor Universitas Mandala Waluya beserta jajarannya. Yang terhormat, para Kepala Lembaga Lingkup Universitas Mandala Waluya. Yang terhormat, Dekan Lingkup Universitas Mandala Waluya. Yang terhormat, para Ketua Program Studi Lingkup Universitas Mandala Waluya. Yang terhormat, Ketua Pengurus Daerah Ikatan Apoteker Indonesia Sulawesi Tenggara. Yang terhormat, Ketua PCIAI Kota Kendari. Dan kami hormati seluruh tamu undangan yang hadir pada hari ini dan serta seluruh peserta seminar internasional. Ladies and gentlemen, we proudly present the 4th of Mandala Waluya International Conference on Pharmaceutical Science and Practice, January 18, 2025. The theme of this event is Innovation and Future Trends in Natural and Pharmaceutical Technologies. It's being a great honor for me to greeting all participants here and welcome each you in indescribable event of the year. Ladies and gentlemen, over the hour this meeting, we please and provide you plenty of opportunity to discuss, to share knowledge and insight. Before we proceed the event, we would like to express our sincere gratitude to our keynote speaker today. The Honorable, the keynote speaker, Professor Apoteker Mukhtaridi, PhD, Department of Pharmaceutical Analysis Medical Chemistry, Faculty of Pharmacy, University of Pajajaran. The Honorable of keynote speaker, Professor Dr. Simon Moser from University of Innsbruck, Austria. The Honorable of invited speaker, Dr. Mulazim Hussain Asim, University of Sargodha, Pakistan. The Honorable of invited speaker, Apoteker Eliza Aiman Azizanur, MPharm SE, PhD from Kitasato University, Japan. The Honorable of invited speaker, Apoteker Ahmad Sali, MPH, University of Mandala Waluya, student of University of Innsbruck, Austria. Ladies and gentlemen, I would like to inform you that this event supported by the first is Bank Sultra. Give applause, please. The second is Bank BNI. The third is Maxima. The fourth is Prodia. The fifth is Apotek Lagoro. And the last is Apotek Education Mandala Waluya. Ladies and gentlemen, without further ado, we would like to transition into the next agenda. We are going to start by singing the national anthem Indonesia Raya and March of University Mandala Waluya. All participants, please stand up. Ladies and gentlemen, please sit down again. We move to the next agenda is Dance of Four Ethnic by the NR Dancer. The floor is yours. Southeast Sulawesi is an island that has four large ethnic groups, namely the Wuna ethnic group, the Moronene ethnic group, Waluya ethnic group, and Tolaki ethnic group. As the four large ethnic groups that live in the land of Anoa have their own characteristic and diversity of regional dance, wherein this dance combine four ethnic cultures in one dance that has its own characteristic, as a symbol of different but still one. This is the offering of four ethnic dance by the NR dancer Kendari. Wuna ethnic group with Linda dance. The Linda dance is a dance that is usually used by Kalambi Wuna when they are about to enter adulthood, carrying out exclusion procession or karya, where the Kalambi Wuna are scheduled for 7 days and 7 nights, and after carrying out the exclusion, the wheel came out by dancing, which is usually called the Linda dance.
Bila kadang dia dan dia kadang dia ada hilang ringan kadang hilang.
Moronene ethnic group, the puzzle and puja movement depict the mutualism of Moronene people, as depicted in the Mountku dance, where his dance is expression of gratitude to God Almighty for the abundance given and keep away from the danger. Buton Ethnic Group. The beautiful and energetic jumps of the dancer depict the dance of Buton Ethnic Group, namely the Balumpa dance. This dance tells the story of group of priests who are singing accompanied by regional song of music. We great joy the sing and dance with happy and sincere hearts. Tolaki Ethnic Group. The Lariang dance is one of the dance offering of the Tolaki people, which is performed in front of distinguished guests as a sense of respect for the guests who visit the Tolaki lands. And the Lula dance symbolizes the unity and togetherness of the Southeast Sulawesi people who hold hands together without looking at someone's origin. That's all performance from the N-Earth dancer. Ladies and gentlemen, now we move on the next agenda is welcoming remarks by Committee Chairman Mr. Apotheker Muhammad Misrul, MSI. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, dear Excellencies, colleagues, ladies and gentlemen. It is with great pleasure and honor that we welcome you to the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice, held virtually on January 18, 2024. This year, our conference embraced the theme of innovation and future trends in natural and phytopharmaceutical technologies, a topic that reflects the dynamic advancement and emerging opportunities in pharmaceutical science and practice. Firstly, let us thank to the God with blessing for good health and opportunity to gather to this event. Secondly, I want to say thank you to the experts who took their valuable time for their busy schedule to join this event. Thirdly, I would like to express my appreciation to Mandala Waluya Foundation, Rector of Mandala Waluya University, and all the staff of Mandala Waluya for their great efforts and support in hosting this conference. I also express my gratitude to the keynote speaker, invited speaker, and all participants who have joined us in this conference. Additionally, I would like to thank the organizing committee for their hard work and dedication in preparing this event so successfully. We are happy to share this conference has attracted great interest with around 600 participants from various backgrounds, including students, lecturers, and professionals. This high participants show that the importance of this conference and the value of natural and pharmaceutical technologies in today's world. Our program features 33 oral presentations and 16 poster presentations, showcasing innovative research and practical advancement in this field. Finally, we sincerely thank our sponsors, which are Bank Sultra, Bank BNI, Rodia, Maxima Laboratorium, and Apotek Lagoro Pharma for their generous support in making this event possible. Your support is very important for us to achieving the goal of this conference and helping the growth of pharmaceutical sciences. On the behalf of organizing committee, we all thank to the participants for their active involvement and hope everyone has a meaningful and inspiring experience. May this conference become a step forward for big discoveries and global connection in pharmaceutical sciences. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Well, ladies and gentlemen, next agenda is introduction greeting. Will open this international seminar by Representative Mr. Toto Suryanto, SKM, MHKS, as the third Vice Rector, University of Mandala Waluya. The time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to convey my greeting and appreciation to all of the invited speakers, especially Professor Dr. Simone Moser from University of Innsbruck, Austria, Professor Apoteker Mutharidi, PhD from Universitas Pajajaran, Indonesia, Dr. Mulazim Hussain Asim from University of Sargodha, Pakistan, Apoteker Eliza Aiman Azizah Nur, MPharm SD, PhD from Kitasato University, Japan, and Apoteker Ahmad Saleh, MPH, student of University of Innsbruck, Austria. Thank you for your participation in our event. Greetings from Universitas Mandala Waluya. On behalf of Universitas Mandala Waluya, it is my great pleasure to declare the fourth Mandala Waluya International Conference in Pharmaceutical Science and Practice is now officially open. As we begin this prestigious event, I would like to extend a warm welcome to participants, especially our distinguished keynote speakers, invited speakers, and presenters, including those joining us from overseas. Your presence is a testament to importance of this conference and its theme, innovation and future trends in natural and phytopharmaceutical technologies. And Technology Universitas Mandala Waluya. This event is an opportunity for researchers, academics, students, healthcare participants, policymakers, and the broader community to collaborate, explore solutions to pressing issues in pharmacy and pharmaceutical science. With 30 the oral presentation and 16 poster presentation, I'm confident that this conference will offer valuable insights and foster meaningful discussions that will enrich the development of pharmaceutical science not only in Indonesia, but also on a global scale. I would also like to take this opportunity to express my sincere thanks go to our sponsor, Bank Sultra, Bank BNI, Maximal Laboratorium Klinik Kendari Branch, Odia, and Apotek Lagoro Farm for their generous support and contribution, which have made this event possible. Finally, I hope all participants will find this conference insightful and inspiring. May it pave the way for further collaboration and advancement in the field. I look forward to seeing you all again in the next MW-ICPSP program. Thank you, and may this conference be a resounding success. Assalamualaikum warahmatullahi wabarakatuh.
ladies and gentlemen, we move in the next agenda is praying by Mr. Apoteker Mulyadi Prasetyo as from MKM. The time is yours.
Bismillah, Assalamualaikum warahmatullahi wabarakatuh, and good morning everyone. Ladies and gentlemen, let us take a moment to bow our heads in prayer for our international seminar, hoping it brings value to all of us. Then I lead this prayer based on the teaching of Islam and the Quran Muslim. You're pleased to pray according to their own beliefs. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala Rasulillah wa ala alihi wa sahbihi wa man tabi'an bi ihsan ila yaumil qiyamah. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Allahumma inni as'aluka ilman nafi'an wa rizqan tayyiban wa 'amalan mutaqabbalan. Rabbana ighfir lana wal ikhwanina alladhina sabaquna bil iman wa la taj'al fi qulubina ghillan lil ladzina amanu Rabbana innaka ra'ufur rahim. Rabbana la tuzigh qulubana ba'da idh hadaitana wa hab lana min ladunka rahmah innaka antal wahhab. Rabbana zalamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana la tu'akhidna in nasina aw akhtana. Rabbana wa la tahmil 'alaina isran kama hamaltahu 'alal ladzina min qablina. Rabbana wa la tuhammilna ma la taqata lana bih wa'fu 'anna waghfir lana warhamna anta maulana fansurna 'alal qaumil kafirin. Rabbana atina min ladunka rahmah wa hayyi' lana min amrina rasyada. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina 'adzabannar. Wa sallallahu ala nabiyyina Muhammad walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Well, ladies and gentlemen, we move to the main agenda today is submission of event to moderator of keynote speaker session. I would like to invite Mr. Apoteker Edwin J.K. Bunggulawa as Pharm MN from Department of Pharmacy University Mandala Waluya to handle this session. In honor, the time is yours.
Good morning, everyone. You can hear my voice?
Yes.
Okay, thank you so much. Good morning, everyone. It's an honor for me to be here again as your moderator. I'm Edwin from Mandala Waluya University, also from Department of Pharmacy. Right now, I am a student, doctoral student in Korea National University of Transportation in Chungju, South Korea. 안녕하세요. 저는 인도네시아에서 온 박사하종 요예성이라고 합니다. Today, I will be your moderator for this section. And in this section, we will have 3 speakers, 1 keynote speakers and 2 invited speakers. Our first speakers will be our keynote speakers from Indonesia. Our first speakers will be Professor Apoteker Mokhtaridi, PhD, from Pajajaran University. And Professor Mokhtaridi was born on Palembang, June 2nd, 1974, and right now is the head of Department of Pharmaceutical Analysis and Medicinal Chemistry, and also like actively doing the research in drug discovery and development from natural product, pharmaceutical analysis for natural product compound. For the education, Professor Mokhtaridi finished his bachelor degree in University of Pajajaran in the Department of Pharmacy and master degree in IPP University for Food Analysis. And the last one, the PhD in University Science Malaysia in Drug Design and Simulation. And Professor Mokhtaridi also has joined so many organizations until right now, such as like Indonesian Pharmacists Association, Collegium of National Pharmacy, Indonesian Medicinal Chemistry Association, NBBI or Indonesian of Bioinformatics and Biodiversity Association, and ASEAN CADD or Computer Aided Drug Design Association, and also have so many grants from Indonesian government, from Dikti and also from the Malaysia, have done so many community services and also many publications, as you can see. And also have done some books and many journals. Okay, we will start our first section with Professor Mokhtaridi. Good morning, Professor. Can you hear me?
Morning, Mr. Edwin. Thank you for your introduction. Nice introduction.
Okay. Thank you so much. How are you doing, Professor?
Fine. I'm in Jakarta because I have also conference, workshop in Jakarta.
Okay, thank you so much for your time, and I will give the time for you for your presentation. It will be around 45 minutes. Please, the time is yours.
Okay. Thank you, Mr. Edwin, for introduction and introduce me to deliver talk. Yeah. To be honored and pleasure to join the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice. So first of all, I would like to thanks to committee for the kind inviting me again to joining the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice. It's the second time I'm joining in the conference. The first time I joining in conference when I was joined in 2nd Mandala Waluya conference. Yeah. Secondly, I would like to congrats to committee that the nice opening ceremony, the big participant, also always the big participant in this conference. So in here, I will join with the other speakers and participants that has academic atmosphere for the research. Yeah. Okay. As requested by committee, I will deliver talk about the role of natural antioxidant in cancer prevention and treatment. So I think Mr. Erwin read my 2020 CV. I forgot to give the new CV. Okay. So as a president Indonesian Society Cancer and Chemo Prevention, our team, last 5 years, we are focused on and studying relationship of antioxidant in cancer prevention and treatment. That's why I will deliver talk about that. Yeah. Okay. Let me introduction about the cancer. As we know, Indonesia has biggest population. Second biggest population in the world. Indonesia has total population around 273 million people. That's why Indonesia in 2020 has the number new cases will be around 300, around 370,000 cases of cancer. Yeah, and unfortunately, around 65% is died. Yeah, by cancer. The number of new cases of breast cancer will increase in both sexes and female for all ages, followed by cervix as you can see in here. For males, lung cancer is number one case with colorectal in the second lead. Yeah, so that cancer is leading cause death worldwide. You can see in this table, accounting for nearly 10 million deaths 2020, or nearly 1 in 6 deaths. So we often hear about cancer, but why are cancer cases always increasing every year? Even Indonesia, breast cancer is first one ranked of the death. Yeah. So what is cancer actually? Okay. Cancer is a disease of the body's cells. Normally, cell growth and multiply in controlled way. However, sometimes cells become abnormal and keep growing and growing. Yeah, and abnormal cells can form a mass called a tumor. Yeah. Cancer cells can break away from the mass or tumor, yeah, it means, and travel via the bloodstream or lymphatic system to different parts of the body. This cell can settle in other parts of the body to form a secondary cancer or metastasis. So, do anybody can be exposed to of cancer? Yeah. Okay. To the risk of cancer increase with age, but no, now in this we also know there are some child to get the cancer, but more than 6 times as many cancer are diagnosed in people over 50 years as in those under 50. Cancer cannot be passed from one person to another and is therefore not contagious, and there is no reason to avoid people with cancer. Yeah, and some cancer is genes are hereditary, and so several family members may have the same or a related type of cancer. So there is a starting point for the development cancer. So how cancer start? Cancer cells has mutation that turn the cell from a normal cell to cancer or abnormal cell. This gene mutation may be inherited, developed over time as we get older and gene wear out, or develop if we are around something that damages our genes. It starts to grow and divide out of control instead of dying when it's out. Cancer cells have the same needs the normal cell as normal cell. They need blood supply to bring oxygen and nutrient to grow and survive. So when a tumor is very small, it can easily grow and it get oxygen and nutrient from nearby blood vessel. So how cancer spreads? As a tumor gets bigger and bigger, cancer cells can spread to our surrounding tissue and structure by fusing on normal tissue beside the tumor. Cancer cell also make enzyme that break down normal cell and tissue as they grow. Yeah, so cancer can also spread from where it first started to other part of the body. This is process is called metastasis. Yeah, metastasis. Okay. Cancer cell can metastasize when they break away from the tumor and travel to the new location in the body through the blood of lymphatic system. So cancer also can start from the production of reactive oxygen stress. Yeah. So the reactive oxygen stress, we call them we call shortcut ROS. Yeah, is produced by regulation by nicotinamide adenine dinucleotide phosphate or NADPase. Yeah, is degraded by enzyme and NADPase oxidase to become NOx in the membranes. This ROS signaling can also affected by formation of free radical. As you can see in this figure, ROS can break the to damage in the mitochondria, leads to neurological disorder, cardiovascular disorder, hepatic disorder, pancreas disorder, also gastrointestinal disorder, and renal disorder. So this ROS damage or damage DNA or stress can be linked to metabolic disorder. Okay, so here is how oxidative stress causes metabolic disorder based on figures. So I tried to put some natural product and here to know many natural compound can influence the can reduce the cancer. For example, curcumin inhibits STAT3 and MMP to reduce the ROS and occur apoptosis. Yeah. Okay. Okay. From this table, we can see the differences between ROS, reactive oxygen stress, and reactive nitrogen stress species, reactive oxygen species and reactive nitrogen species, and how RNS is produced from ROS. Yeah, ROS can be produced from exogenous source like air, water pollution, UV, and so on. In addition to ROS and RNS, free radical also have a pathological role in our body. Okay. In the role of ROS RNS in carcinogenesis processes, oxygen and nitrogen reactive species produce the damage in DNA, and other biomolecules, and play major role in genetic instability to become progression throughout in the cell cycle, cell repair, and the type of cell death in here. Free radicals are also important in cell transformation, differentiation, and cell proliferation process, and may be useful to evaluation tissue inflammatory response. Yeah. As this figure, with respect to carcinogenesis, this radical have been implicated in tumor progression, angiogenesis, immune response, metabolic disease, and so on. Yeah. So here you can you can see this figure showing the effect of antioxidant from natural product and the molecular signaling mechanism. So, in other words, ROS mechanism also can lead to cancer. ROS can be damage of molecular, degradation of protein, and damage of DNA. That's why ROS has correlation with cancer cell pathogenesis. Okay, at low concentration, ROS promotes cancer cell survival by activating growth factor and MAP kinases or MAPKs. Yeah. At high concentration, ROS produce oxidative stress that activates apoptosis. So that's why ROS is very dangerous for our body. Okay. So now there are new approaches for treating cancers. For treating cancer cell with the pro-oxidant compounds. Yeah. You can see this figure for oxidant compounds, which increase ROS generation in the cancer, or cancel out the cellular antioxidant, yeah, in the tumor itself. Nuclear erythroid factor 2 and nuclear factor kappa beta is key rule, a key transcription factor that play a role in regulating cellular responses to oxidative stress. Yeah. Okay. So this the mechanism how the antioxidant in the interplay between oxidative stress and senescence. Yeah. In the certain situation, normal cell can experience premature aging. We call it senescence. Yeah, which is a cellular phenomenon resulting from the errors of the cell cycle in the response to various stresses, such as the use of chemotherapy on oxidative stress. The use antioxidant in here, yeah, can indirectly inhibit the process of cellular senescence with nuclear erythroid factor 2. Yeah. Although cellular senescence is associated with disease, in the current development, cellular senescence is widely targeted in cancer cell therapy with the hope the cancer cell will not develop further and then die. So let's move to antioxidant status in the body. Disruption of redox balance in cell result in activation of redox sensitive transcription factor such as nuclear erythroid factor 2 or NRF2, nuclear factor kappa beta, and activator protein or AP1. Activation of the NRF2 pathway enables cells adaptation and survival by regulating expression through antioxidant, anti-inflammation, and detoxification enzymes. Yeah. So we normally have this antioxidant in the body that regulate by NRF2. So, however, the level of antioxidant in the body is very low. Yeah. So if the ROS is increasing in the body, we need antioxidant of outside. Yeah, outside antioxidant it means. So why we use natural product for the antioxidant? You know, WHO states that 80% of the world total population use natural product as an alternative medicine option. Even Indonesia is the second mega biodiversity of natural product. Yeah, 14% is marine, 7% characterize flora and other fauna. And you know that Indonesia has reached herbal medicine. There are 30,000 plants, 11% of the world, and 7,700 characterized, and as 1,500 as jamu. We call jamu. 70 standardized herbs and 20 phytopharmaca, and around 300 plants were known to have bioactive compounds. Yeah. But the main problem with medicine raw material is the synthesized drug as imported by overseas. So this opportunity to develop the natural product in our country, yeah. Okay, so we have to collaborate with inter-institution, yeah, like the inter-university. Okay, so natural product, yeah, can has the Richmond antioxidant properties, yeah, antioxidant compound that inhibit the oxidation of the other molecules or agents that have the ability to be hydrogen of electron donor. Humans can produce antioxidant in the body that cooperate with each other to protect cells from free radical damage and scavenging roles by regulating antioxidant defenses, and blocking oxidation processes by neutralizing free radicals. Okay, antioxidant can be natural, yeah, enzymatic and non-enzymatic, or synthetic compound, like the enzymatic such as superoxide dismutase, catalase, or nutrient-containing compounds taken with food and as dietary supplements such as vitamin C, vitamin E, and so on. High antioxidant food, like fruit and vegetables, have protective effect against certain cancers. Yeah, it's proven to have a lower risk developing cancer of the mouth, pharynx, larynx, esophagus, and so on. Yeah. However, we have to awareness about how to use natural antioxidant. Yeah. I prefer to use complex antioxidant. I mean, not single compound. Yeah, because there's still a complex form rather than a pure compound or a concentrate supplement. And for people who receive chemotherapy or radiotherapy treatment, such as supplement may be harmful. Okay, this the control is the example. This is the control trial of dietary antioxidant supplement for cancer prevention. Yeah, for example, this the from China research, Linxian General Population Nutrition, using the clinical trial with 15 milligrams beta carotenes, 30 milligrams of tocopherol, 50 microgram of selenium. So the study resulted healthy men and women. Okay. Also, some trial for the antioxidant. Okay. So let's move to antioxidant mechanism of against cancer. How come the natural antioxidant against cancer prevention and treatment? Okay. So in the high concentration of antioxidant will increase antioxidant defense and can be used as chemoprevention, but decrease roles and also minimize side effect of chemotherapy and radiotherapy. In the low concentration of antioxidant can trigger an increase of root oxidative stress and cell death through chemoradiotherapy and also causing DNA damage. Yeah. So, as mentioned it before, at lower concentration of natural antioxidant can increase cellular antioxidant activity in the body. This is useful for protecting cell from the side effect caused during chemo and or radiotherapy in cancer treatment. On the other hand, the same compound use a higher concentration of antioxidant will inhibit antioxidant defenses and induce oxidative stress or induce apoptosis in cancer cells. This can increase the effectiveness of chemotherapy and radiotherapy and make it possible to lower their dosages. Yeah. These some example natural product antioxidant that resumed by our journal, yeah, epigenin, curcumin, epigallocatechin, quercetin, and so on. Okay, the data reported in this section show that the polyphenolic compound, yeah, bergamot, oleuropein, quercetin, and curcumin have the ability to reduce cell viability in cancer by the mechanism, able to stop the continuation of the cell cycle, induce apoptotic death, and increase the expression of the tumor transcription factor P53. Yeah. Okay. Antioxidant properties of catechin in here were two mechanisms. Yeah, it's direct antioxidant and indirect antioxidant effect. It's the flavonoid, yeah, phenolic compound of the catechin. Yeah, direct antioxidant effect occurring by ROS capains and metal ion chelators, while indirect antioxidant effect occur by triggering the antioxidant enzyme reducer, pro-oxidant enzyme inhibitors, or stress-related signaling pathway suppressor. Okay. Let's move to antioxidant activity of compound of teflopin in black tea, like the teflopin. Yeah. Okay. The teflopin has the good antioxidant. All the phenolic flavonoid compound of the tea, like the black tea and green tea, has good antioxidant. This is the order of the of antioxidant of teflopin. Yeah. The degree of LDL oxidation was mentioned by measuring the production of thiobarbitic acid reactive substances or TBARS. Yeah, all catechin and teflopin tested by inhibiting iron cuprum mediated LDN oxidation. Yeah. Okay. So this the order of the capability of the antioxidant starting from teflopin, epigallocatechin gallate, and so on. Yeah. Okay. As mentioned before, high physiological stress and poor nutritional profile or low concentration antioxidant in body can increase ROS, and reduce and induce oxidative stress and causing DNA damage and mutation or tumor suppressor genes causing cancer. Yeah. So this is green tea known to have bioactive compound like epigallocatechin that has activity to inhibit cell surface and receptor. Yeah, here. Cell surface receptor signal transducing pathway, to allow the decreasing of EGF, to inhibit of cell viability, inhibit the angiogenesis, and induce of the apoptosis to treatment cancer. Yeah, this our study testing result of the green tea on MD-MBE 231 breast cancer 10 BC, 10 BC. So you can see the ethyl acetate fraction shows a good IC50 with the 35.78 ppm. Yeah. So in the green tea contain the major flavonoid we call AGCG, epigallocatechin 3 gallons. Doses of 5 until 30 micromole per liters. This compound can inhibit cells transformation, can inhibit transcriptional activity and DNA binding activity. Yeah, the maximum tolerated dose of epigallocatechin 3 gallons both ways, is 2,300 micromoles per liters. Yeah. Oral administration of pure AGCG at a dose 1.6 gram in healthy human volunteers resulted in physiological relevant plasma of this compound concentration with good potential health effect. Yeah, it's very interesting result. So the result confirmed that less 5% of orally administered dose of tea reach the systematic circulation. It has been established that the highest plasma concentration of AGCG is only 1.15 micromole per liters, or equivalent 2 cups of green tea used in human. So if you drink green tea without sugar every day, it's very good for you. Okay. Okay, this is the combination AGCG and polyphenol rosella. AGCG protects oxidized LDL, induce injury to human endothelial cells with the rosella, like the autophagy, angiogenesis, metastasis, and apoptosis. Here. Okay, sorry, in bahasa. Okay, how about theaflavin? Theaflavin, we resume from the many journal the activity theaflavin of the black tea, for the anti-cancer activity, that found in black tea. Numerous some study have investigated the potential of theaflavin in combating various type of cancer. That's why, anti-breast cancer, liver cancer, leukemia cancer, a lot of cancer. So, okay, even we found that theaflavin induced apoptosis in P53 mutated human breast cancer cells. P53 is very important and major role in the cancer regulates. Molecular mechanism of theaflavin induced activation of the mitochondria mediated that cascade in P53 mutated human breast cancer cell. It's very interesting. Okay. Okay. the other target is MMP in cancer. Yeah. Okay. Metastasis refers to the process by which cancer cell disseminate from the primary organ through blood vessel and subsequently invade the organ. MMP is matrix metalloproteinase, is a crucial protein involved in tumor proliferation and metastasis. Its proteolytic activity, various alteration in the tumor microenvironment. This enzyme regulates numerous physiological processes and signaling events, making the pivotal players in molecular communication with tumors. Yeah, there are 23 MMP that expressed in human. Yeah, for the example, glutinase MMP2 and MMP9 are a major secreted MMPs in breast cancer. Okay, human activation through hydrolysis MMP2 and MP3, MP9. I mean, degrade basement membrane, basement membrane type 4 collagen and to enable metastasis. Okay. This the other recent mechanism of theaflavin MMP2 inhibition by in vitro and in silico. This is the very interesting result. Even the researcher reported that theaflavin stable with the complexity MMP2. Okay, so the good ICPT is found it. Yeah, it's found it in here. Yeah, so the binding capacity with MMP2 was consistent with the other on inhibitory capacity and was opposite to the other obsteric hindrance of theaflavin. It's very interesting result. However, why do we often drink tea, but still feel that it lack antioxidant and is less healthy? Yeah, so there are three. The question for us. The first one, is it mixed with sugar? The first two. Yeah. Is it drink with the heavy food like the milk, rice, and so on? Yeah. So this research, this Xiang and et al. With the title research tea consumption, milk or sweetener addition, genetic variation in caffeine metabolism, and incident venous thromboembolism. Yeah, you can see that here. Yeah, tea with milk. I mean, the black tea reduce 15% the risk of the venous thromboembolism. Yeah, but no activity if the tea added sweetener. Okay, it's the first one. There's to influence of the drinking tea. Yeah, the third, drinking tea has been spent. Drinking tea that has been spent for more than 1 until 3 hours. Yeah, you can see the figures. Yeah, we can tell how the stability of green tea catechin and theaflavin in different water temperatures. Yeah, you can see in one you can this 3 hours. So if you put your tea 1 and 3 hours, the antioxidant is decreased. The capacity of antioxidant is decreased. Yeah. Okay. It's also this study is very interesting. Okay. So how to solve the case? So in order to be effective, it is necessary to encapsulate the tea so that the antioxidants are better. Yeah. One of the solution is using collagen for the encapsulation. Why collagen? Yeah, because the collagen, yeah, activates some marker and the cancer. Yeah, you can see the because the time is limited, so I just you can see the effect of collagen. Collagen interacts with the certain receptor like the integrins or cancer cell. This interaction trigger a series of chemical reaction within cell that cause charge in the cell side. Yeah, so very interesting the reason. So after that, we can encapsulate it of green tea or AGCG, AGCG, using the collagen. Yeah, this is the result of the capability of antioxidant. The green tea is stable. Okay. Okay. You can see there that collagen and green tea can increasing dose. Yeah. Increasing MMP to 9, rapid degradation of sponge material, reduce scaffold effect, and full bond formation. So after encapsulated, yeah, the green tea and gelatin or collagen decreasing rose, decreasing MMP to 9, slow degradation or sponge material, better scaffold effect, and excellent bond formation. Okay, you can see in this result as mentioned above. Okay. Okay. The other this case report using the green tea encapsulated collagen. There are child 4 years old with this stage 4 of cancer, retinoblastoma cancer. So no chemotherapy after 2 years. Yeah. So we use the green tea encapsulated with the collagen. So it's very good. Now it's very healthy. This the second one, the brain cancer after surgery. This child using the green tea, collagen and alginate. Yeah, the boys can play like the normal child. Very interesting. Okay. Okay. The other compound is curcumin because my time is very short. Yeah, curcumin. I think we often heard about the curcumin activity for against cancer. Yeah, I think the problem is same. Yeah, with the tea. Yeah, also alpha-mangosteen. Yeah. My 10 years study on alpha-mangosteen. Alpha-mangosteen is very interesting. The good activity of cancer, but the problem is this solubility. Yeah, solubility and interaction with the body because it's non-polar properties. Yeah. Okay, we have some research cancer with the fatty acid synthesis, with the MCF7, MD, T47D. The activity is very good. Yeah. So we try to encapsulate it alpha-mangosteen with glitosan. Yeah, and induced by mice. Induced cancer by mice. So the activity is very good. Yeah, there are 4 time-fold the activity increasing. Yeah, okay. So the result of this the study of alpha-mangosteen indicate that alpha-mangosteen induce internal rose formation activate ASKP38 signaling pathway and mitochondrial ruptures, followed by MMP loss. Yeah. So in here, BCL2 decrease to trigger cascade 9 and cascade 3 cascade and induce apoptosis in cervical cancer cells. As a result, the result that alpha-myosin significantly disrupted mitochondrial integrity as measured by the loss MMPs, matrix petrol proteins, in a concentration-dependent manner, like this figure. Yeah, just very interesting results. Okay, sorry. No, our empirical and treatment, some of the treatment and prevention that have been done using the antioxidant. Yeah, we using 100 grams of mangosteen fill to twice to reduce the severity of breast cancer patients. Mangosteen fill and rosella flower brew, tea, avoid the mastectomy. 100 grams of 2 stems of dragon spike roots reduce breast metastatic stage. This is our experience. Yeah, the complex antioxidant can enhance or suppress the effectiveness anti-tumor treatment and even protect healthy tissues against damage caused by oxidative stress. Yeah, the current evidence suggests that supplementation or administration of natural antioxidant of outside, during cancer treatment may contribute to improving its efficiency. So finally, the reflection or conclusion of this talk, the body makes its own antioxidant to regulate health. It's very important for us. Yeah, increase even more by eating the whole diet. Brightly colored fruits and vegetables such as tomatoes, carrots, spinach, broccoli, sweet potatoes, strawberries, and citrus fruits and major sauce. Yeah, all whole grains, nuts, seeds, and natural ingredients also contain antioxidant. So you can eat this food. Yeah. So the recommendation for this talk. Okay, natural antioxidant in complex form, not singular, are more recommended for cancer prevention and treatment by metabolizing ROS back to normal. But a single antioxidant can be used as advised by doctor specialists, with consideration of side effect. Okay, it's time for my talk. So thank you. This our students, our student PhD and master, and I would like to thank also to PT Alga Rosa Nusantara, the Alga Tea Research, University Science Malaysia for our collaborator, and Graduate School of Siba University. Thank you.
Thank you so much, Professor Mokhtarity, for a really, really, really good presentation. It's really broadened our knowledge in this field, especially about the cancers itself, and also like how so far the scientists already use the herbal medicine to treat the cancer. Okay, everyone, right now we will move to next section for question and answer, Q&A. I already have one question first from the Sultan. Oh, we already have 3. One will ask directly, so I will read for you the first one from Sultan. What are the potential risks and limitations on relying on dietary antioxidant supplementation during cancer treatment? such as like chemotherapy or radiotherapy?
Okay, it's a good question. Then I think many patient, many people ask to me about that. So when you got the cancer, you have to eat the more antioxidant. You mean during even the also antioxidants will be free radical if you eat more. Okay, so as my recommendation, the dose, yeah, you can consultation to pharmacist or medical physicist to to use the dose during the cancer treatment. So, for example, our experience in our patient in the retinoblastoma cancer, this child used 2 teacup every day. Yeah, sorry, every morning. So every morning and every night, every day. And after 1 year, the child is reduced the cancer. So I think my recommendation, you can consult with the pharmacist or the doctor. We have the book, the how to use the dosage of the natural antioxidant if you want. Yeah, but you have to aware, don't use even natural antioxidant. Natural antioxidant is unlimited. Yeah. So, for example, if you're healthy is okay. Please don't use don't drink vitamin C 1000 every day, yeah, because it's dangerous for you. Because when the antioxidant status of in the body is enough for the antioxidant level, the antioxidant outside will become free radical. Yeah. Okay. This is my question. My
Okay.
answer for question.
Okay. Okay. Thank you so much, Professor. And another question is here from Risky. The question is like natural antioxidant can help prevent cancer by reducing oxidative stress and protecting cells from damage. However, some studies have found that antioxidant may not have entirely absolute anti-tumor properties. But what about the food? Consuming food rich in like vitamin, minerals, and essential antioxidant is highly beneficial, making health lifestyle
Yeah.
choice, styling active, and like maintaining a healthy weight can significantly reduce the risk of cancer. But yet, do antioxidant in food really prevent cancer? So, like, do we can just eat them like as the food, or like we should take them as a medicine, like herbal medicine? Maybe like that in
Okay.
simple way.
Okay. The other good question. Yeah. Sometimes we have wrong the lifestyle. Yeah. For example, Mr. Erwin, we eat the fruit after we eat the rice. Yeah. We eat the vegetable after we eat the rice and the meal and so on. So the good antioxidant activity when you use the antioxidant after you drink the mineral water. You drink mineral water. After that, you can take the natural antioxidant like the fruit, apple, lemon, and vegetable like the broccoli. So the antioxidant will be working properly. Yeah, but if you like the coffee, you drink coffee with the sugars. Yeah, it's it's very sweety. You drink coffee with the sugars, with the milk, and very sweety. Is, I think, not good for lifestyle. So if you got the cancer, you get the tumor. Uh, please don't take the coffee with sugars and milk. Yeah. Please use the natural antioxidant properly. Sometimes the natural antioxidant will not work when you eat not properly. Yeah, is my answer, Mr. Irwin.
Okay, thank you so much. So maybe in short, like you can eat the dietary really good for your health, but sometimes people just want to make it delicious. So like in
Yeah,
reduce,
yeah.
like
And
reduce
mixing with
the
the
antioxidant. Yeah,
mixing with the meat,
yeah, I
you
understood.
can
Like
spread.
maybe because like we want to eat delicious food, so we
Yeah,
make it delicious, but in the other hand, we indirectly reduce the effect of the food, like the healthiest of the food. Okay, Professor, and one question from uh, Apotheker Ahmad Saleh, and he will directly
okay.
asking this question.
Yeah, I think Pak Saleh is my close friend, so we can
Ah,
discuss uh, everywhere, every time. Ya. Pak Saleh, apa
okay.
kabar Pak
Halo,
Saleh? Ya.
Assalamualaikum.
Waalaikumsalam, Pak Saleh, apa kabar? Ya.
Oke, Alhamdulillah baik, Pak. Really interesting about alpha mangosteen. So I saw the structures. So there is two options. Perhaps we can do it sooner or later. So regarding the structures, so I was thinking that we can conjugate with some lipid polymers, for instance. This is the
Oh, very
first
nice
option.
idea.
And
Good
secondly,
idea.
we can do it like the charge conversion polymers. So we synthesize some polymers, and then sometimes, for instance, we can cover the surface with can be converted by charge conversion, because as you already mentioned about the cancers, but I'm not expert with the cancers or something like that. So there is two options. We can do it sooner or later. First, we
Yeah,
can
we'll
conjugate with the
collaborate.
lipid
Yeah.
polymers. Secondly, perhaps like we can do it charge conversion polymer and with the liposome. So in general, I'm really nice to see you. We
Thank
are
you, Pak
busy
Saleh.
just
Thank you,
two
Pak Saleh.
months ago in Eastbrook. So
Yeah,
that's all. Thank you so much for your great presentation, sir.
welcome. Thank you. Okay, we will collaborate soon.
Okay, thank you so much. And maybe, Professor, one last question. We still
Yeah.
have one. Maybe we can make it like short. Like the question is from Neil Zoom Azara. Is there
Yeah.
a risk of over promoting the benefit of natural antioxidant without sufficient clinical evidence, potentially leading patients to prioritize like unproven remedies over evidence-based treatment? And how can researchers and practitioners balance ethical consideration while exploring the potential of the natural antioxidant?
Yeah. I think the antioxidant is also material drugs, yeah, the candidate drugs. So if you eat unlimited, is every medicine has the risks, even without clinical evidence. But if you eat without clinical evidence, you eat limited, yeah. So I think the dose must be proven by clinical evidence. Okay, but if you, for example, you want to eat the natural antioxidant, but you don't know the dose, yeah. So you can eat. So you eat apple. You don't know the dose. You just eat the 1 to 2 apple every day. Don't eat 1 kilos every day. Yeah. Uh, it, I think same when you eat the rice. Yeah, the rice. The limit rice. you can eat 3 times, morning, 3 times for the eating. The same with the natural antioxidant. You have the wise to take the natural antioxidant. Okay, so I think we have the risks. A lot of I think the stuff of the chemical, natural and synthetic is like even the jamu, jamu. If you eat jamu more, every day you eat jamu 3 times, you can got kidney syndrome, because I think the evidence, the clinical evidence is very, very important for us. Thank you.
Okay, thank you so much, Professor. And it's really, really, really nice to meet you. And thank you for broadening our knowledge, because since I am also a doctoral degree and doing the research on herbal medicine and nanotechnology, so it's really, really amazing presentation for me. Okay, Professor, thank you so much for your time. And this right now, the Mandala Waluya University will give the certificate for you.
Thank you.
Maybe for the MC, please.
Thank you very much, Studio Moderator. Now we move to the next agenda. Let us to enter in the coffee break around 10 minutes. Also for online or during participant, please take a break for 10 minutes and we will come back again.
Thank you so much, Professor, for your time.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peran penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sultra terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru BSKI Bank Sultra Kris melalui aplikasi Bank Sultra Mobile. Kini ada cara yang lebih mudah liburan bareng teman. BSKI gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sultra, urusan beres, liburan pun jadi lebih nyaman. BSKI gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Sultra, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan, buat BSKI jadi lebih pede. Mau kulineran? BSKI nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan, dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup dandeng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sultra melalui Bank Sultra Mobile. Dari Bank Sultra, maju bersama.
Well, ladies and gentlemen, our coffee break is end. Now we continue our agenda is the second speaker and will be handled by our moderator, Mr. Edwin J.K. Bunggulawa is from MN. As a moderator, the time is yours.
Okay, thank you so much for the MC. Welcome back to our section. Welcome back to our seminar. We will resume our seminar to our next speaker. And in this section, we will have two speakers, two invited speakers. The first speaker is from Pakistan, Dr. Muzalim Hussain Asim from the University of Sargodha, Pakistan. And the second one is Apotheker Eliza Aiman Aziza Nur, Master of Pharmaceutical Science PhD from Kitasato University, Japan. Okay, we will move to our first invited speaker is Dr. Mulazim Hussain Asim. He is assistant professor in a public sector university. Right now, he is teaching the PharmD student and supervising MPhil and PhD student for research work activities in University of Sargodha in Sargodha, Pakistan. He is also a lecturer, like teaching pharmaceutical quality management and pharmaceutical technology to PharmD student, and in the University of Lahore in Pakistan, and also like production pharmacy in Think Pharmaceutical Lahore, Pakistan. For the education, he took his PhD in pharmaceutical technology and like the research on mucosal drug delivery system, mucoadhesion, and the permission studies of different drugs in the University of Innsbruck, Austria. And the duration is from March 2006 until May 2008, and MPhil in pharmaceutics in Islamia University of Bahawalpur, Punjab in Pakistan. And he also comprehend 3 different language, Urdu, English, and also Punjabi, and publish so many research article in the international journal, as we can see. Okay. Maybe we can start to our first invited speakers. Good morning, Dr. Mulazim Hussain Asim. Good morning, doctor.
Yeah, thank you very much, administration of Mandala University. So first of all, a lot of thanks for inviting me for this lecture. So really, it is a good opportunity for me to interact with some international students which are fresh in the field. So it will be clear for me to give some very good input to the student internationally, so that it will be a very good contribution from my side. So first of all, just only this thing that a lot of good information for you. So can we start? Can you show me the presentation?
Professor. Okay, Professor, let's start. The time is yours.
Yeah, okay. Can I share my presentation? Just a second, I'm just going to share my presentation.
Yes, please, Professor.
Yeah, that's okay. Okay, so first of all, I think so there is a very good introduction from the administration. So I am just a very quick review that I am Dr. Mulazim Hussain Asim. So I have done my PhD from University of Innsbruck in pharmaceutical nanotechnology. And basically my field is for some novel drug delivery system in which usually we enhance the bioavailability of those drugs which are not showing good solubility. So basically, I try to conjugate this project with herbal medicine as well, because you know that all the latest novel chemicals are basically derived from plants, which are basically medicinal plant, and these are all called as the herbal product as well. So basically, a lot of such products which are of herbal origin, they also have some issue of their solubility as well. So I just want to discuss this, the importance and recent development of nanotechnology-based EDS in herbal medicine. So basically, if we see the overview, that basically there is herbal medicine which has a lot of dosage form. You can get the extract, you can make some granules, even if you go towards some conventional dosage form, you can make some tablet as well and some capsule ointment as well. But our basic focus will be these three things, because there are some nanoparticles, there are some solid dispersion, and there are some emulsion. So basically, these are the things which are the latest one, because these are basically known as nano formulation. And the biggest advantage of nano formulation on other formulation has been discussed later on. Just very briefly, the main difference between nano formulation and conventional is basically, first point is safety concern, because in nanotechnology, basically we design targeted drug delivery. And you know that if there is a formulation which release the drug targetedly, then definitely you will need the drug in some less amount. When the amount of drug will be less, and you will be also well aware that toxicity is in most cases concentration dependent. Means that if you will use a huge dose of anything, there will be more chances of a toxicity. So in targeted drug delivery systems, which are basically a nanotechnology based system, we use target release. So when you did target release, then there are very less chances that there should be any wastage of drug. So we use a very less amount of drug. And when amount of drug is less, then definitely there are less side effect of this. So this is a huge advantage of this formulation. Another big advantage is basically more targeted delivery. You have not toxic to, because if you want to release a drug on a specific body part and your formulation is circulating in the whole blood, then definitely it will cause a lot of problem. So when you will release the drug right on the target site, it will give a lot of advantage. So I will discuss it later on. So I was just giving only the reduction. So if you see that we see that there are a lot of therapeutic effect, but you see that these are some less side effect as well, and they will increase the bioavailability of that formulation as well. Okay. So next is basically the use of the herbal medicine, because we have some lack of scientific restriction and process difficulty, because the main issue of herbal formulation is this, that one herbal product contains so many products. So first of all, we have to extract our required element, you can say required molecule, which is definitely a novel one from that, and then we have to proceed it. And then the modern phytopharmaceutical particles, they can be suspended into some nano formulation, which I was stating earlier, that these can be nanoparticles, these can be some microemulsion. They can also be some nano emulsion as well. And there are some matrix system, because these matrix systems are just going to control the release of drug in a better way. Then there are some solid dispersion. Basically, these are some latest drug delivery system in which we usually use some lipid nanoparticle. The two very famous are solid lipid nanoparticle, and the most advanced one are NLCs, we call this. These are basically nanostructured lipid carriers. So these are basically the advanced form of these lipid nanoparticles are liposomes. And even latest formulation in which nowadays we are working a lot, they are known as small lipids. So maybe I am not going detail of these, because these are nanotechnology based terms, and we are not going to discuss this. So I was just going to target this with the help of this formulation. In most of the convenient dosage form, the limited amount of research doses, basically I was just talking about this, that the other formulation has some problem. So in this, we just go for that better way. So that's why we can discuss this. Can you listen to me? Hello.
Yes, Professor?
Yeah, is everything okay?
Yes,
Okay,
please
okay.
continue
Okay, okay,
the
okay.
presentation.
Okay. So next we are going to discuss about some more effect of this, because when you talk about some nanoparticle, then the basic thing is that we have to target those medicine which have some solubility issues. So basically these are some target drug delivery, their effectiveness and safety of medicine. So these three parameters are more prominent, which you can say that make these novel DDS more ideal for herbal medicine due to its target drug release. Then effectiveness. Effectiveness come in the sense of the effective of that formulation, because when a formulation will be available in some MEC, you can say minimum effective concentration, then definitely it will give you, because when there is a target release, then there are very less chances of that your formulation will not be deteriorated, and then it will be more effective as well, and then the safety concern. So next, the more important is that when we talk about nanotechnology, then the size of particle is very important. So if you see here, there are some very small nanoparticle in some nanometer. So these tiny particle, if they are in range of 100 nanometer, then they are considered as ideal for this formulation. So if we go towards some herbal medicine, which is basically need of the hour. So basically here he said that there is some wider application of these novel DDS because of these advantages. And the reason is that they improve solubility, then definitely, then effectiveness and reduce the frequent dose as well. Another more advantage of this novel DDS in herbal is this, that when you take a medicine in this form, then you have to not dosing every time. For example, most cases, the doctor prescribe that take this medicine 3 times a day. So it will sometimes become very difficult in the busy schedule of the patient that you take the medicine exactly after 8 hours. So it become very difficult. So if you can't take the medicine at the right time, then you can't claim that its effectiveness will be so lasting. And it is okay in some normal diseases, because it doesn't matter if you're taking some antibiotic. But in case of some serious diseases, for example, cancer patient, so if you take this medicine at wrong time, so maybe you know that cancer cells are dividing at very large speed in very less time of time. So if you are taking medicine for 1 day, and in this 1 day, for example, 1 hour is less amount of drug in the blood below MEC, then these cell will grow much more faster, and you can't afford that your cell again grow and you become a cancer patient again. So for this, the sustained, targeted and controlled drug release is a very, very basic need of the patient. So basically these novel DDS are designed for this purpose, that you take a medicine. Even nowadays such formulations are available which ensure the medicine for 72 hours, mean that you take a medicine once, and for 3 days it will be sufficiently providing you the minimum effective concentration, so that it will remain in the blood, and it will release drug for the frequent time, so that there is no need to take medicine every 8 hours. So this is a huge improvement, because and next is the reduction toxicity we have discussed again, and then enhanced permeation and retention. This is a basic advantage of this nucleus. There are some specific drug delivery systems which are known as mucoadhesive, because if you want to increase the permeability and retention of drug, then the most important is that drug remain much more time in the blood, and it enhances them. Basically, next, I'm just quickly winding up these things because these are very basic. So there are some nanoparticles. Basically, these are the base of novel DTS. And definitely, when you talk about the nano size, then its size, surface, and shape are very important, because a nanoparticle has to permeate through mucus. So if there will be irregular shape, if there will be a larger size, then definitely it will have to face a lot of obstacle to enter into the blood. So the smaller the size, the more regular is the shape, the more better will be the chances of permeation. So next, you can see here you can see the pictures that there are some nanoparticles which are much more common. There are some lipid particles, some solid particles, and there is some overview of the nanoparticle which are much more being used. And there are some lipid particles in the previous position, it was also discussed that for permeation of something, the lipid carrier are very important because this lipid always enhance the permeation of drug molecule into the bloodstream. So these are basically lipid-based nanoparticle are very being popular nowadays. So next is some nanocarriers. So if we discuss about nanoparticle and nanocarrier, basically nanocarrier are a system which basically carry the drug to the circulation. For example, there are some very famous polymer as well, for example, cyclotextin. So they work as a carrier because drug is encapsulated in these cytorection and thus they take it to the bloodstream. So basically these nanocarrier also deliver a drug in a very better way. So you can see here the list of a lot of nanocarriers. You can see some micelles, some liposomes, some lyosomes, some nanogels, and these are also very common nowadays. They are not so much in the market because some latest particle available. But once these different metal nanoparticle and this mesoporous nanoparticle were very common, but now they are being replaced gradually with some this range of particles which are basically lipid based. Even lipids is liposome, lyosome are also not getting too much attention. I will discuss later on some drawback of these nano formulation as well in the end. So maybe I will discuss that later. So next you can see that how a nano formulation will help a herbal active ingredient to be in the system. So for this purpose, there are some lists. There are polymeric nanoparticles, some SLNs, some magnetic nanoparticles, some metal-based particles, some polymeric, some phospholipid, and then colloidal nanoparticle. And there is a huge list of these nanoparticles, which are nowadays very common for this purpose as well. So there are some more information about this system, and the most important is herbal drug loading. Another advantage of this system that you can load a lot of drug in this system, because if we talk about these previous carriers, the main problem was basically that the amount of drug was not, because if you want to release a drug for 2 days, for 3 days, even for 24 hours, it means that you have to take a lot of drug into the system, which will be just a drug delivery system. So if the drug is not loaded in a proper way in that system, then there is a useless of using the system, because it will collapse and a lot of drug will be released, which will be a negative effect instead of positive effect. So the loading of drug, we talk about drug loading efficiency, and another term we use is drug loading capacity as well. So these two terms usually run parallel. So all the latest nano formulation which are designed for these novel drug delivery systems, they must have good loading capacity. And if I talk about the latest nano formulation, for example, nanostructured lipid carrier, so they are being ideal nowadays due to their much more drug loading. Another thing which is very parallel to this one is basically the stability of formulation. There are some formulation which are unstable when they are loaded with higher amount. Then again, it's useless. If the drug is leaking from the system, then there is no need to make such system. So we should have to design such system which will load a drug in a better way, and then they release it gradually. Otherwise, they should leak it. And leaking is not a property, because leaking is uncontrolled phenomena, and you cannot get the desired formulations effect. Here is some picture of some nanoparticle which are basically loading some herbal formulations for making some nanoparticles. So you just take a plant and then you separate, isolate some phytochemicals, and then there are some lipid-based nanoparticles. You just load them, and then you design a herbal loaded nanoparticle, which are nowadays being used very widely. So we just highlighting some technique that if you want to load some nanoparticle with these herbal particles, then there is a list of different formulation techniques that how you can load a drug. There is some hot and cold homogenization technique, some high pressure. So there is a lot of detailed literature that how we can use these techniques. So I'm not going to detail of this technique, just a name that there is some conservation technique, some co-preservation technique, some salting rule. Basically, these are the method by which you can enrich the nano formulation with some formulation. So here is some list of herbal formulation. which are nowadays very common. So you can see here the list that these are the formulation. Basically, these are SLNs, solid nanoparticles, and if you see it, there is some active, which is basically herbal formulation, curcumide, and basically the function. You can see it that there are some anti-cancer, some hepatoprotected, then some anti-liver toxicity, antiviral, some anti-epileptic. So there is a huge list, even in the all targeted diseases. Even in the previous lecture, it was about very good information about the cancer. So if you talk about herbal, nowadays, the herbal product which have some anti-cancer activity, they are getting a much good. If I talk about this curcumide, so basically there is a compound which is known as curcumin. It has shown a very good anti-cancer activity, and this is being widely used. For example, oleanolic acid, Chinese medicine herbal product, we can easily extract this oleanolic acid, and it is also being used, being now discussed here. So another is silylamine, and this is also a silymarine as well. So this is hepatoprotective effect. So basically, these are the most common diseases nowadays, and these herbal medicine are really playing some wonder in these medicines. So next is some detail of this formulation. So if you say that around 80% of our population is still using, when I was in Europe, so if we talk about Germany, a very established country in Europe, I was shocked to see that they are much more giving more attention to herbal formulation as compared to these allopathic medicines, which is basically the domain of our community, which we call it pharmacist community. So the basic reason of this was that because they still believe that a substance from natural origin has a much more better effect than we synthesize in the lab. So they have some myths. So a lot of people still use that medicines. So if you can see that we have discussed some more medicine that they are going for some malaria treatment, they are used from some other effect. For example, some anti-cancer, Praxitexil. Again, this is again from plant source, and then the silymarine. So basically, these are the terms which we are going to use a lot. So let me go for next. So next, if we give that, what is the application of nanotechnology-based diagnostic system of natural compound? So basically, if we talk about natural products, they have a huge application in the field of treatment of different medicines. So if we talk about this cancer treatment and other chronic human diseases, so basically these are the ideal for this purpose. So in the last portion of this presentation, I will just try to make some targeted disease. So for example, first of all, we use some antibacterial activity, and just keeping in mind that basically these are some antibiotic. Here, as you can see that raptomycin and then fluxamycin, these are basically some, I think so. Let me show you. Okay. So the most rich and rich product derived antibiotic, they are just so, and there is some curcumin and some zujajil and some cinnamon products. So these are also being used as well. So next, I think so. Again, another disease. This is Alzheimer's disease as well. So basically, if you see here some product which are some curcumin product, some other products, so these are also being widely used for this purpose as well. And there are some alkaloids. You can say that some berberine and some antibiotics, they are also shown some anti-inflammatory effect. So basically, they are also used for as well. They are also very common disease nowadays. So there is a list of some more prominent pharmaceutical phytochemicals which are being used for latest some diseases as well. Another most important application of this is basically some anti-cancer activity. So if we call about anti-cancer activity, then you can see that a lot of different products which are being used. So basically, some very old time there was going some tradition, but nowadays the basic thing is that if there was a reported plant which shows some anti-cancer activity, so nowadays the advantage is that we have a lot of isolation and purification technique. So we can rightly separate the compound which have basic anti-cancer activity. So nanotechnology is just focusing is that properly isolate the compound first and then just make it in the nano formulation and deliver to the target site. So next is some minor part about the biodistribution of some natural compound by nanocarrier. So basically, if you take that, the one more important thing is that nano formulation is shifting a medicine from IV route to oral route, which means that, for example, there is a lot of medicine which have some solubility and viability issue. So for this purpose, we give these medicines through IV route. For example, the best example is insulin. Insulin is usually inserted in diabetes patient through IV route because insulin is a protein and it will be degraded. It is some large molecule as well. It has a lot of problem of permeation. So its viability is very less orally. So what the nano formulation is nowadays doing, so they are shifting the formulation from IV route to oral route, because a formulation which is basically given through IV route, it has a lot of drawback, and the main drawback is patient compliance. Usually in Pakistan, they say that children never like the injections, but I have some different belief. I believe that nobody in any stage of life like injection. I never say that the old people or some young people like the injection. No one even like. So if you shift a formulation which is in some injection form to some oral form, then it will be a huge contribution. For example, a lot of attempts are still being made to convert this oral insulin as well. Still, there is a lot of belief as well, but still it's not 100%. So in future, it will be possible that there will be a lot of permeation enhancing technique in which you can shift the formulation, which is poorly soluble and poorly formular, which is basically a class 4 drug. We can shift from that IV route to oral route as well. So basically, this is what the nano formulation is doing for us. So this is all detail which we are discussing about. So the last portion of our formulation is some issue which we have to face for these nano carrier. And the first one is a difficulty in scaling up process. So nano formulation, usually the first problem is their stability issue. So when you design a nano formulation, because the big problem is that when you commercialize a product, so for commercialization, the main thing is manufacturing cost. So if you make a nano formulation and it take a lot of time, it take a lot of chemical, then its overall the cost will be enhanced. And when this product go in commercially, then if you have to make commercially and it is very expensive, though it is not an ideal choice for those manufacturers. So the latest problem is the high cost, which is due to a lot of use of surfactant, co-surfactant, stabilizing agent, and other things. So it make the cost of the formulation very high. And the pharmaceutical companies never go toward this, because if the formulation cost is very high, so then they have to sell out these medicine, and if they are out of the reach of the patient, then it will make their less sale. So they are just going still with the traditional ways, the old ways, which have definitely some less benefit, but because they are some cheaper method and they are giving them some better benefits, so still they are there. So the latest issue for nano formulation is that make such formulation which will make them less expensive, so that they will attract the pharmaceutical company to make it for ideal. And next, the most important one is the toxicity of this formulation. Because when you use a lot of these surfactant and other ingredient in this, then definitely it make the formulation some toxic as well. So there is a lot of surfactant which show some toxicity as well, especially the cationic one. So these are some of the issues, and then is the permeation to some sensitive part of the body, such as the biological membrane. You can say blood-brain barrier as well. So these are the basically issue we are still facing for these nano formulation. And I think so we are in the second last slide of the presentation. So the controlled and selective release of natural compounds. So basically, this is if we compare the conventional route with these controlled DDS, the basic thing is controlling the release phenomena. Because I was talking about that if there will be selective or control release of drug, then it will be much more better for us that we can deliver that medicine in a better way. So what we concluded from our tour prediction that these herbal formulation has a lot of good pharmacological activities, but these pharmacological activities will be only achieved in a better way only when they will release at the right site at the right time in a right quantity. So to release a herbal pharmaceutical product in the target site at the better time in a better amount, the only choice is these novel DTS. So next is the future in the pharmaceuticals. So definitely, I was talking about some drawback of this formulation. So we have to find out some ways so that we can get some better formulation which is more stable, and the most effective is they are less cost as well. And definitely we have to target some natural compound which will be definitely phytochemical, and this will definitely increase a significant benefit which will improve the bioavailability and biodistribution. So basically these are the ultimate target of a formulation which we are going to discuss, and this is some recommendation, you can say some future recommendation, that we should also know some molecular mechanism, because the basic thing is that when we drive a natural product, its compound, we just know that how its compound work, because when you are living in some DTS, it will not be effective if we doesn't know the mechanism of action of that. So first of all, we have to much more focus that how will be the mechanism of that target compound, and then it's some pre-clinical investigation, because when you are loading these bioactive compound in non-formulation, we just know these investigation as well. And then some gene and protein expression, because a lot of active compound hormonal product need to be effective as well. And there are some different derivative, there are some polymorphism of compound as well. In one form it will be more active, in other it will be not, so we must know about this thing as well, because these are the field which are very less targeted now. So there are some chemotherapeutic and therapeutic which will be effectively to some specific patient. So for example, there will be a specific active compound which will be more good for some patient but not, because if there is a co-disease, mean if there is a patient of one disease and it also have some other disease, so it's definitely pathophysiology will be different for other patient. So we must know about the pathophysiology of patient. So it is not as a take out the personalized medicine. For example, if one medicine is good for one cancer patient, so for other patient, no doubt it will be good, but again, we should make focus that is there any difference in the pathophysiology of both patients. So if other patient have some other problem, and due to that problem, maybe that medicine will not be so good, and that context, maybe we have to change its formulation for that matter. So there is some pharmacokinetic and pharmacokinetic parameter. So we have to need to be better discuss these parameters as well. So basically, this was the concept we are discussing about. So I think so. Now the session is open for any question answer session. I think so. We have some maybe 5-10 minutes.
Okay, thank you so much, Dr. Azim.
Yeah.
The question and answer section will be held after the second speaker, so we'll be together. We'll be the second
Okay.
speaker. So we will come back to you after the second.
Okay.
Sure. Thank you so much for your presentation. It's really cool, and it's really gave us more knowledge about how to implement the herbal medicine into the nanotechnology, because nanotechnology these days is really popular among the scientists, and it's really good.
Yeah. Okay.
Thank you so much. We will come back to you after the second speaker's presentation. Thank you so much, Professor. Okay, we will move to our next speaker. Our next speaker will be Dr. Apotheker Eliza Ayman Azizanur from Japan. She was born in Makassar, Indonesia, February 10, 1994, and right now she is the assistant professor in Department of Microbial Chemistry, Graduate School of Pharmaceutical Science in Kitasato University, Japan. Education background: she took her doctoral degree in pharmaceutical science in Kitasato University, Japan, and STEM University for the master degree, and for bachelor and for pharmacy, profession of pharmacy in Hasanuddin University in Indonesia. And she also has published several international journal, as you can see. Okay, we will start. Good morning, Dr. Eliza Aiman Aziza Nur.
Oh, good morning. Hello, very nice
Can
to
you
meet
hear me?
you.
Really nice to meet you also. Thank you so much for joining us for our international conference today. It's really
Oh, thank
honored to
you.
have
Thank you
you
so much
here.
for inviting
Okay.
me. It's gonna be a really great time. So, should I start?
Yeah, okay. The time is yours, please.
Thank you. Thank you. So, let me share. Which one? Oh, wait. Oh, wait a second.
It's okay. Take your time, doctor.
Later. Okay. Is it shared yet? Not yet. Okay.
Okay.
Is it shared? Okay. Okay. So I can start now? Is it okay?
Yes, please, doctor.
Okay. So thank you very much for the change that given to me. In this presentation, I will talk okay. So in this presentation, first I will introduce myself, and then I will introduce what kind of work that we are doing in our lab. And then after that, I will go to the main topic, which is the screening for natural lipid regulators from natural resources. So in here, I will give two examples. The first one is from the herbal medicine, which is atractylose rhizome. And the second one is from fungi. Okay. So for introduction, maybe the MC already told. My name is Eliza Aiman Azanur. So I was from in Makassar, and I took my bachelor degree and also profession of pharmacy in Hasanuddin University. Then in 2017, I went to Japan and finished my master and doctoral degree in Kitasato University. Right after that, I became an assistant professor in the Department of Microbial Chemistry, Graduate School of Pharmaceutical Science, Kitasato University, Japan. So first, I will tell a story about our university. So Kitasato University is a private university that has 6 campuses and also experimental farm. And Kitasato University has been focusing in life science. So as you can see in here, the graduate school and undergraduate school only consists of life science topics. So our home is in Shirakane campus. So in here, in the heart of Tokyo, it's only have 2 schools, School of Pharmacy and also Graduate School of Pharmaceutical Science. So Kitasato Group is actually have many pioneers in the life science and drug discovery research. For example, the Kitasato Shibasaburo Sensei, he was the first person to isolate the tetanus bacillus. And for Fujiki Tahata Sensei, he is the one who discovered the anti-tumor drug mitomycin and also antibacterial drug kitasamycin. While the famous Omura Sensei is the one who won the Nobel Prize in 2015 for ivermectin. So a little bit of ivermectin. Ivermectin is antiparasitic drug that is been isolated from Streptomyces avermitilis, and these microorganisms are isolated from the soil of golf course in Shizuoka Prefecture. So our research is actually the backbone for this. So I will tell a story about our microbial chemistry lab, the research outline. So this is how we actually perform research in our group. So first, we'll do the isolation and also cultivate in microbes. So we take the microbes from various environment, from soil, marine, hot spring, and then cultivate it and make it for a culture broth. And this culture broth will be screened for several new bioactive compound in many screening system. Well, for example, in here, antibacterial agent, regulator of lipid metabolism or bone metabolism, and also from antimicrobial clinical drug. After that, if we found a promising compound, we will do study of mechanism of action using a variation of analysis method. The aim is to get what is the target molecule of the bioactive compound and also to clarify the mechanism of action of our compound. The second one, after that, if the compound is unique, we also perform analysis of biosynthetic pathway and also for in vivo evaluation using animal models. So that is the research that every day been doing in here. So for my part, I've been take interest in natural lipid regulators. So in here, I will go with two story. So the first, let me tell about the background of it. So here is the data of cardiovascular diseases rate in the world from 2010 to 2019. Our home, Sulawesi, is actually suffer from the increase of cardiovascular death rate for over up to 15% in just 9 years. So the factors are gonna be, more Western lifestyles. And because of that, I've been taking interest for these cardiovascular diseases. So you know that lipid is actually stored as natural lipid, such as cholesterol ester and triacylglycerol, or TG. They were stored in the droplet called lipid droplet. And because of lifestyle, it can have excessive accumulation that leading to disease such as atherosclerosis, obesity, which is the main risk factor for cardiovascular diseases. It also can lead to the fatty liver diseases. So our idea is to limit the CE and TG synthesis. In here, we perform screening using this method. So we are using Chinese hamster ovarium cells. We put the samples and also radiolabeled oleic acid and incubate it for 6 hours to produce radiolabeled CE and radiolabeled TG. And after that, after the extraction and separation by LTLC, we will get this kind of data. So if the samples, the screening broth is active, it will show smaller dot of the radiolabeled CE or radiolabeled TG. So we use this same method to search for the new active compound. Okay, so the first sample is Acratilodes rhizome. It's a traditional herbal medicine from 2 plants, Japonica koizumi, and also the Ophatade candule. So they are known for diuretic, stomachic, antisudorific, and anti-inflammatory. But this rhizome extract was actually found to be active in our established assay. So that's why I perform isolation of it. First, the rhizome was gone to the fine powder, and then we extracted using this solvent, and the material were then separated in silica gel column chromatography, and the fourth fraction of 100 was go to the more preparative HPLC, and in here we got two compounds and one mixture of the compound. Compound 1 is sesquiterpene attractylonate 3, and it is known for having this activity. And the compound 2 is polyacetylene compound, while compound 3 and 4 is a mixture that we cannot unfortunately purify each other. So compound 3 is polyacetylene that differ in the alpha methylbutyl, while the compound 4 is the beta methylbutyl. So if we take a look at these four compound activity, it is selective to inhibit the synthesis of CE. If you take a look at the natural lipid synthesis itself, TG were synthesized in the glycerol 3-phosphate G3P pathway, while the cholesterol ester in here are specified being produced by sterol or acyltransferase or SOT. Okay, so let me tell a bit about SOT. SOT is an enzyme that is a membrane-bound enzyme, and it actually works by attaching acyl group to the cholesterol. So cholesterol is the form that we are using as energy, while CE is the form of the cholesterol when it's stored. And sterol acyltransferase has two isozymes, SOT1 and SOT2. SOT1 is distributed in various cells all over the body, while the SOT2 only expressed in the small intestine and liver. Well, selective inhibition of SOT1 is being proven to have a good activity for cancer and Alzheimer's diseases, while selective inhibition of SOT2 is sound to have an effect to arteriosclerosis and fatty liver diseases. So our main focus is in selective compound for SOT2. So we obtained new cells in here. So from the wild cells, we inserted human SOT1 and also human SOT2, so two different types of cells, and then perform our assay using that cells. While on that, we also perform enzyme-based assay to make the microsomal fraction of these cells and to see the enzyme activity of it. So here's the four compound. Well, unfortunately, the polyacetylene compound only show dual type, and even in an enzyme base is also dual type. So in here we cannot obtain the selective SOT2 activity of these compounds. But this case also show that even the known compound, they actually can have a new activity. Okay, so let me go to the next one, is terpendal congeners. This is from fungi. So the fungi is actually collected in Shizuoka. And after identification, it was identified as Voltera siltinella. And in our screening, the culture broth is also selectively inhibited CE synthesis. First, I will show you the fermentation and extraction of this fungi. So the fungi was seed cultured for 3 days and then inoculated into the main culture. So the culture medium are shown in here. The culture were then extracted by using 70% ethanol, and the extract were then extracted again with ethyl acetate. The ethyl acetate extract were then subjected to the ODS column chromatography. And from the HPLC preparative, in 60% of ODS, we found two compounds in here, NK12838, and a new compound. So this is a new compound called terpenyl N. While from 80% one, we found two new compounds, phosphamines A and phosphamines B. From 80% two, we got a new compound again, terpenyl O, noun terpenyl C, and a mixture of related compounds. While in 100%, we also got terpenyl C, D, L, polypropylidine A, and also the mixture of related compounds. So the mixture of related compounds were then separated by using different column, the phenol C30, to gain a new compound, terpenyl P and terpenyl J. So here's all the compound that we isolate from this fungi. In there, we got 5 new compounds and other 6 non-compound. And what is interesting in here, phosphamine A and B have the hemiaminal moiety in there that is not being found in other terpenyl compounds, while terpenyl N is a very rare that only have 7 rings. I'm sorry, only have 4 rings in their structure. So we then check these compounds' activity against SOT1 and SOT2 because they selectively inhibit CE synthesis. And here we know that all the compounds except terpenyl N and polypropylidine A have the inhibitory activity, while it's only phosphamine B that show the selectivity against SOT2. And to give you a little bit of the image, so this is 3 compounds that is actually been in the clinical trials. Afastimab and pactimab from Pfizer and Sankyo are dual type of SOT inhibitor that already gone to the clinical trial for ulcerative colitis, while by Kowa factory, K604 were only been to the phase 2 of the atherosclerosis clinical trial. So this show that actually it is very important to have a SOT2 selective inhibitor. And if you take a look at the activity, our compound were very compatible with it. So lastly, I will show a structure activity relationship of terpenyl congeners for SOT inhibition activity. So our compound is pretty much strong, but we still not know about the pharmacodynamic or how the compound is stable in human if we were about to give it as a drug. So our compound will be drug-late. And in here, the relationship of the structure is shown. And R1, the isoprenyl residue, is not essential, while the ring, so the 7 ring in here are actually important. And then for other, for R5 or R4, hydrogen is more preferable. Well, the crucial part in here that the R3, if you have a methoxy, it will be crucial for SOT2 selectivity. Okay, so that is all from me. So for the summary, so in our lab, we focus on isolating and discovering drug component that will become a drug itself. And our focus in the natural researches. And this project actually show how natural products are rich source for bioactive compound. And for acknowledgements, I will say thank you very much for my team members and also for the chemical team members. And here's a picture of our group. And that is the end of my presentation.
Thank you so much,
Thank you
Dr.
so much.
Asisana. It's really interesting research that you have done, and maybe like some of us may be unfamiliar, as you know, like in Indonesia, maybe as a especially as a pharmacy student, it's not really familiar research about like this one. It's like your research here is really detailed, and you make the compound not just become the next drug, but isolate them and analyze them into really detail. It's really interesting. Thank you so much.
Thank you so much.
Okay. Okay, everyone. We will move to Q&A section. We invite again our first speaker, Dr. Asim. Please
Yeah, I'm here.
join us. Okay. Okay, we already have some question here. Maybe first for Dr. Asim.
Yeah,
The
yeah.
question is for from Risky. And the question is, the strategy for applying nanotechnology to plant extract has been widely cited in the literature because of nanostructure system could potentially potentiate action of plant extract, promote sustained release and active constituent, reduce the required dose, decrease side effect, and improve activity. However, despite these potential benefits, how will nanomedicine impact our society? Maybe like these days, our society have already familiar with the herbal drug, but how can this nanomedicine, like nanomedicine based natural product impact our society?
Okay, a really very good question. And basically, this was also the theme of our presentation as well. Basically, the problem is this, that the herbal product which are removed from plants, there are some herbal products which has some bioavailability issue. Mean, if we gave them orally, they can't be absorbed through GIT and can't reach the blood circulation. And then we have to move towards some intravenous formulation. And these formulation has some serious side effect, and they are not an ideal formulation for any patient due to some patient compliance. So patient always want that there should be some oral formulation. Another, the best thing is that nowadays the most popular disease is in all over the world is cancer. And for cancer, we always need a drug in a control release manner, because we can't risk that we give some time that our drug should be less than minimum of expression and the cancer cell grow again. So basically, the nano formulation is providing the delivery of drug in a better way. So the basic theme of this nanotechnology is this, that no doubt this potential is already reported in a lot of time, but nanotechnology is revolutionary in a way that we are providing in a better control, sustained way, so that we can achieve the desired result. For example, the most prominent is a targeted drug release. So the nanotechnology is doing what? It is releasing the drug on site of action, where the cancer cells are. Drug will release at the site point, and this is a huge contribution of this nanotechnology as compared to other conventional drug release system. Another thing which I was discussing is the safety. And if you see that safety is most commonly related with the dose of drug, and if you are releasing the drug targetedly, then definitely less amount of drug will be required. And when the amount of drug will be less, definitely it will have some less side effect. For example, if one part of body has some problem and you distribute the drug in the whole blood, then definitely it will have some side effect to the whole body. So if you release a drug only on the site of action, it always gives you a better result, as well as it will be less toxic as well. So this is what the nanotechnology is doing for the humanity nowadays.
Okay, thank you so much, Doctor.
Welcome.
Okay, maybe because of our time, our last question will be from me. I really have so many questions so far, but maybe I will give my last question, maybe to Dr. Azizanur,
Oh, yeah.
because I really interested in your research, current research, like in the
Mhm.
SWOT2. Like so far you've done like for maybe I can say like you try to find out which component that can selectively only inhibit the SOT2, not like SOT1 and SOT2 in the same time, but selectively on the SOT2. And my question is like how far you've done about this uh, inhibition of SOT2 and the effect on like lipid management in our body. Since like I saw like your presentation, this like SOT2 maybe like the effect on the disease such as like atherosclerosis and also the fatty liver. But how about uh, selectively SOT2 inhibition for our overall like lipid management in our body?
Oh, very good questions.
Yeah.
So the thing is, for the compound that I show in here is a terpendal compound, and the selectivity is only 1 point. So we already have another compound that is actually been isolated from another, what is it from again? It's also fungi. So I cannot say the compound right now because the compound is in the clinical trial.
Okay.
So the compound have around 1,000 selectivity to the SOT2. So the compound itself, so for that compound only, we perform more to in vivo. So we already synthesize the compound and test it in the mouse model. And the data, I cannot show you the data, but the compound show actually no side effect, not prominent side effect, and because it's specific SOT inhibitor, so it only decrease the CE level. So
Okay.
the TG, so usually if we go to the TG inhibitor, it will make an unbalance of the lipid component in our body.
Right.
But
Right.
for the CE, for the cholesterol, we rarely see that. So only
Okay.
the CE level are being dropped, but the cholesterol level is being maintained in our in vivo model. So yeah, probably the compound itself will be entering phase 2 in 5 years. In 5 years, they said. So we just started the phase 1 right now.
It's really interesting, and hopefully your experiment going really well in the
Oh,
future.
thank you.
And
Thank
I
you
hope
very much.
I can, in the future, I can collaborate with both of you, Dr. Asim and also Dr. Aziz
Oh,
Anur.
it's
Most
Both of
welcome.
you, since I also
it
like
will be an honor.
working on like herbal medicine and nanotechnology, and also
Mhm.
like like testing in pharmacology and also like the molecular. Thank you so much. Thank you so
Thank
much.
you so
Okay.
much.
Since like we have really limited time, this end of our question and answer section, and from the Mandala Waluya University will give the certificate for both of you. Thank you so much for joining our conference
Thank
today,
you.
and thank you so much for sharing your knowledge. It's really wonderful to having to both of you here. Even I am as like a doctoral student here, really awesome.
Oh,
Feel really awesome. Like it's really new for me and like really many insight maybe for my future works also. Thank you so much. Maybe
thanks.
from the Mandala Waluya University can okay, this is the VP certificate for both of you. Okay, the first is for
Yeah.
Dr. Mulazim and second one is for Dr. Eliza Aiman Aziza Nur. Thank you so much for
Thank you so
today.
much.
Thank you very much.
Thank you
Thank you
very
so much.
much.
Hopefully can meet you again in our next conference.
Yeah,
Thank
sure.
you.
Okay,
Sure,
Good
sure.
sure.
morning.
Okay. Thanks. Thanks a lot.
Okay, thank you so
Thank
much
you.
everyone for today, and this is the end of first section. The next section will be started after like lunch break, I think. Thank you so much, and thank you so much also for having me as your moderator in this section. Okay, I will give the conference comeback again to the MC. Thank you so much. 감사합니다.
Well, ladies and gentlemen, that's all the first session discussion to our seminar international today. Now we move in the next agenda is poster presentation by the committee. And we move in the next agenda is lunch and break. And I allow you all participant, online participant and offline participant to come back again at 1 o'clock to join or to continue our discussion in Seminar International today. Thank you very much.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peran penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sostra terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, Beski, Bank Sultra Kris melalui aplikasi Bank Sultra Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Meski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sultra, urusan beres, liburan pun jadi lebih nyaman. Meski nggak perlu panik kalau belum tarik tunai. Tinggal scan dengan kris Bank Sultra, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan buat Beski jadi lebih pede. Mau kulineran? Beski nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup dandeng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sultra melalui Bank Sultra Mobile. Dari Bank Sultra, maju bersama.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peran penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sentral terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, BESKI, Bank Sentral Kris, melalui aplikasi Bank Sentral Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Meski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sentral, urusan beres, liburan pun jadi lebih nyaman. Meski gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Sentral, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan, buat BESKI jadi lebih pede. Mau kulineran? BESKI nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan, dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup dandeng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sentral melalui Bank Sentral Mobile. Dari Bank Sentral, maju bersama.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peran penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sentral terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, BSKI, Bank Sentral Kris, melalui aplikasi Bank Sentral Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Meski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sentral, urusan beres, liburan pun jadi lebih nyaman. Meski gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Sentral, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan, buat BSI jadi lebih pede. Mau kulineran? BSI nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan, dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup dandeng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sentral melalui Bank Sentral Mobile. Dari Bank Sentral, maju bersama.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peran penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sultra terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, Beski, Bank Sultra Kris, melalui aplikasi Bank Sultra Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Beski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sultra, urusan beres, liburan pun jadi lebih nyaman. Beski gak perlu panik kalau belum tarik tunai. Tinggal scan dengan kris Bank Sultra, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan buat Beski jadi lebih pede. Mau kulineran? Beski gak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan, dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup dandeng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sultra melalui Bank Sultra Mobile. Dari Bank Sultra, maju bersama.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peran penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Sultra terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, BESKI, Bank Sultra Kris, melalui aplikasi Bank Sultra Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Meski gak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sultra, urusan beres, liburan pun jadi lebih nyaman. Meski gak perlu panik kalau belum tarik tunai. Tinggal scan, dengan kris Bank Sultra, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan, buat BESKI jadi lebih pede. Mau kulineran? BESKI nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja, cukup nenteng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sultra melalui Bank Sultra Mobile. Dari Bank Sultra, maju bersama.
Coba kali itu juga. Coba itu. Kemudian dia lihat ikan bapak itu, dia bilang katanya Pak, dia bilang katanya Pak, siapa sih namanya? Pak, dia bilang katanya kasih masuk nih, tapi kan cuma dilihat, masih nggak dilihat aja sama bapak itu. Bilang begitu. Begitu dia cuma suara itu biasanya dari gimana? Itu dia nggak bisa begitu saya. Dia bilang ini cuma dulu Pak.
from MSE. The time is yours. Tes.
Ladies and gentlemen, may I have your attention, please? The conference will begin shortly. Thank you for preparing yourself to join our virtual conference. Please make yourself comfortable. Thank you very much for joining our conference. Assalamualaikum warahmatullahi wabarakatuh. And good afternoon to everyone in Indonesia, and good morning for our speakers in Austria. Alhamdulillahirrabbilalamin, segala puji senantiasa kita panjatkan kehadirat Allah Subhanahu wa Ta'ala atas segala limpahan rahmat dan karunia-Nya. Respectable founders of Mandala Waluya University, Honorable Rector of Mandala Waluya University, represented by the Vice Rector 3 for Cooperation and Student Affairs, Mr. Toto Suryanto, SKM MHKS. Honorable Dean of the Faculty of Science and Technology, Ms. Dr. Sri Anggarini Rashid, MSc. Honorable Chairman of the Department of Pharmacy, Faculty of Science and Technology, Dr. Apoteker Musifaya, MSc. And dear Pharmacy Department lecturers and honorable participants of the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice. I would also like to extend my respect to our keynote and invited speakers. Ladies and gentlemen and honored guests, on behalf of the organizing committee, I am delighted to welcome all of you the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice with the theme Innovation and Future Trends in Natural and Phytopharmaceutical Technologies. It is an honor for me, Selvi Rahmawati Saranani, to serve as your moderator for this esteemed event. Today, we have the privilege of hearing from distinguished invited speaker, Mr. Apoteker Ahmad Saleh, MPH, from Mandala Waluya University, and PhD student, University of Innsbruck, Austria. So before we begin, let me briefly explain the structure of today's program. We will start with invited speeches, followed a Q&A session. And for our virtual attendees, please feel free to use the chat box to send in your question. It is a great honor to introduce our invited speaker, is Mr. Ahmad Saleh, Apoteker Ahmad Saleh, MPH from Mandala Waluya University and PhD student, University of Innsbruck, Austria. He will present a game-changing approach for the delivery of antifungal proteins, HIP or HOP. Please join me in welcoming Apoteker Ahmad Saleh, MPH. Now, to provide a better understanding of our speakers' background in remarkable achievement, allow me to present their curriculum vitae. This will highlight their expertise and significant contribution in this field. Okay. Curriculum vitae Ahmad Saleh. He is a pharmacist and he is born in Indonesia. Her objective, self-motivated team player with strong organizational and interpersonal skill, always looking to learn new skill, take on extra responsibilities, and grow professionality. Education, 2090 during present PSD Pharmaceutical Science in Institute of Pharmacy, University of Innsbruck, Austria. 2009 during 2010 master degree from Gajah Mada University Yogyakarta, Indonesia. 2008 during 2009 pharmacist in Indonesian Islamic University Yogyakarta, Indonesia. 2004 and during 2008 Bachelor of Pharmacy Indonesian Muslim University Makassar, Indonesia, and experiences head of Department Pharmacy in Universitas Mandala Waluya, lecturer at Universitas Mandala Waluya Kendari, Indonesia, and pharmacy supervisor. Next, organization Indonesian Pharmacy Association Branch Kendari Science 2010. Research funding and awards. 1. Research grant for young lecturer 2012 during 2017 from the Ministry of Education, Culture, Research and Technology of the Republic of Indonesia. Lecturer certification 2010 from the Ministry of Education, Culture, Research and Technology of the Republic of Indonesia, and a doctoral scholarship from the University of Innsbruck, categories promoting of young talent. 2024. Research skill, designing of drug carrier system for oral delivery of the therapeutics, changes converting nanocarriers for mucosal drug delivery, lipid-based nanoparticles for oral peptide delivery, analysis and screening of drug using different analytical chemistry procedure and tools, chemical synthesis and characterization of novel pharmaceutical excipients, and operation and handling of synthesizer for measuring size and surface charges of nanosystem. In vitro cell cultures, working with different cell line, and expert working with HPLC, chicken and AR, and the toxicology studies and safety screening of the chemicals, excipients, and newly designed. Okay, and the last list of scientific publication is several publication. Many publication for our speaker today. Okay. Mr. Ahmad Saleh, can you hear me?
Yes, please. Yes, please. Can you also hear me?
Okay. What the time it is in Australia right now?
So it's 6 o'clock in the morning. It's quite morning. Early
Well,
morning.
morning ya, good morning. Okay. Mr. Ahmad Saleh, we have 30 minutes to present material and 15 minutes for Q&A session. Yeah. And Mr. Ahmad Saleh, the screen is yours. We are looking forward to your insightful presentation on the future trends in natural and phytopharmaceutical technologies. Please go ahead.
Okay, thank you very much for moderators. It was really great explain about me. So, Assalamualaikum warahmatullahi wabarakatuh. And hey everyone, good afternoon. So, first of all, I would like to deliver special thanks to Civitas Academica Mandala Waluya and also to the committee for inviting us, and of course for all participants who joined this prestigious event today. Secondly, I would like to welcome our keynote speaker, Professor Mustaridi from Pajajaran University, and also Professor Simone Mosers. So perhaps she already joined. And also Dr. Azim, actually he is my senior in Eastbrook, as you know, our senior. And also Dr. Aliza from Japan, nice to see you. So in this opportunity, I would like to sharing our experiences how to deliver protein from natural origins. So in this opportunity, I'm gonna share a little bit about introduction of ADR and about the polycationic dilemma and strategy to overcome. And we're gonna talk about the concept of zeta potential changing systems. And I'm gonna tell about alkaline phosphatase. We use this as trigger effect in drug delivery systems. And of course, I will a little bit explain you about a research point of view, what already done. In the end, I will sum up my presentations. So let me move to the next slide. So basically, actually, antimicrobial drug resistance has reached the concerning level, as you can see, is, among us global public health problems. As you can see, Candida species are the most common causative, or let's say invasive fungal infection, especially in Asia. So in order to overcome this problem, perhaps a novel treatment option such as antifungal protein from natural origin can consider as a promising alternative. So let's move to the polycationic dilemma, as I mentioned before. So basically, if you develop nanocarriers, and then we know that we already use for several purposes in drug delivery systems. However, when nanocarriers facing the polyanionic membrane, as you can see, which is like mucous membrane or the skin membrane, so cationic charge not sufficiently accelerated in the body barrier system. So to that, we develop nanocarrier systems that can enhance uptake with the cell membrane, because we know the cell membrane have heparin sulfate, which is negatively charged. So actually, polycationic substrates are difficult to reach the cell membrane because they are facing with the polyanionic membrane, which it have a negative charge, as you can see here. So therefore, we need to develop, let's say, nanocarrier system, for instance, nanoparticles or lipid-based nanocarrier system. So then we need also the positive zeta potential in the hand, because with the zeta potential positive, we can enhance a cellular uptake. So it's simply cellular uptake. So we have to enhance cellular uptake, because it's a most important process regarding, how can I say, regarding regulation, the biological activity in molecules. So it is like determined by interaction between the molecules and the plasma membrane. So as you can see, generally negative charge structures of the cell membrane can allow the negative charge of material to pass the throat easily. So we move to the next slide. So in this slide, we can simply understand about zeta potential changing system. So basically, to overcome the polycationic dilemma, as I mentioned before, we develop zeta potential changing nanocarrier systems. They can enable polymeric or even living-based carrier systems. So these carriers has initially negative charge. So on the way, let's say like electrostatic repulsion force, and then they can pass through the mucus gel layer, and they can also pass the serum protein, and also can reach to the target membrane, and they can change the zeta potential from negative to positive values. So in our case, we utilize trigger enzyme, for instance, alkaline phosphatase, and we are cleaving the negative charge, for instance, from phosphate group, let's say polyphosphate or 3-polyphosphate, and we can tune to the positive recharge carrier, something like that, and then we know that can be uptake by target cell. So as I mentioned before about alkaline phosphatase, so, or sometimes we call it like drug delivery trigger enzyme of alkaline phosphatase. So as you can see, alkaline phosphatase, you can see distribution of alkaline phosphatase in our bodies, like intestine, colon, and lung, vagina, cervical mucosa, and endometrium. So we use this trigger enzyme to prove that our nanocarriers can also even work in our bodies. So let's talk about a recent point of view. So our works have been published in the Journal of College Interface a couple of years ago, which is impact factors quite high, 9.9. So we are a team. We are collaborated to Professor Florentin from the Institute Molecular Biology Medical University Innsbruck. So basically, we got the IE, will explain later, and then they already label it, and then our task just want to deliver the protein antifungals. So as you can see, we already succeed to develop post-degradable nanoparticles, like novel treatment options such as antifungal proteins from natural origins, perhaps can consider as a promising, promising alternative. So in this regard, we utilize Penicillium chrysogenum is antifungi proteins, or PIV, because we know that some of the researchers mentioned about the high potential being one of the most extensively characterized antifungal protein from the fungi. So this PAFA, let's say it's a small, let's say like cysteine-rich cationic peptide, cysteine cationic proteins, and have ground inhibitor properties against various pathogenic fungi, including Candida species. So as you can see, we also utilize polyphosphate because we know that polyphosphate as a biodegradable auxiliary agent that are considered as a safer food and also pharmaceutical product according to the report of FDA and of course also World Health Organizations. So let me explain how to prepare and characteristic them. So move to the next slide. So before that, as I mentioned before, that our protein was purified from the fungi, and also we conjugate with the green fluorophore, for instance. So then after, so we prepare by in situ gelation method, utilizing electrostatic interaction opposite of the charge of the PIE and the polyphosphate. So as you can see, we play around concentration of those substrates like 1 to 3, and also we dilute it in the difference buffer. Even we also dilute it with the demineralization water pH 7. So as you can see in the table, we already exhibited, we already achieved different size from, let's say, 208 to 551, and also with the behavior of the size distributions, and also with the different zeta potentials, negative zeta potentials. So we also continuous evaluation about the morphological characterize our nanoparticles as utilize TEM imaging. As you can see, here's our nanoparticles display, can I say, spherical shape and homogeneous size distribution. So to that, as you can see here, F2B we choose as a promising nanoparticles because, can I say, we obtain with a minimal size around 309 and zeta potential around minus 11 millivolt. So, and then we also investigation about the cytotoxic evaluation on the human cell. So basically in this study, we utilize a skin cell line, and it's a human foreskin fibroblast. And we can see the potential cytotoxic effect about our product compared to the naked or unmodified product on cell. And then also we determine by resazurin assay. So in this case, in these studies, we utilize Triton X100 as a positive control. So if you can see in the figures, our cell, we tolerate with the PAFA with the different concentrations displaying over around 95% viability in all antifungal protein in the concentration manners when we apply in DMEM and also when we apply with wild MEM. Then after, we future investigate about hemolytic activity. So basically, this assay is a simple method to estimate the possibility, the making effect of development formulation on the cell membranes. So In this case, we utilize red blood cell. So it's easy to prepare. For instance, you prepare your formulation and then you dilute it with the different concentrations, and then you incubate it with the red blood cell, and then you can measure by taken, for instance. So as you can see in the figures, when we incubating of RBCS with the antifungal agents within 24 hours, below 5% hemolysis we achieve in all cases. So we assume that our naked PAV and also PAV polyphosphate nanoparticle can be considered as a non-hemolytic nanocarriers. Then after, we also investigation diffusion across biofilm matrix. So in order to evaluate the penetration behaviors in our projects, so as you can see in the tables, compare with the PAFA, or let's say I will say naked nanoparticles with the modified nanoparticle displaying higher, what can I say, higher diffusion time in the liquid media. So this outcome is likely derived from large particles, as you can see in the table one. It's large particles, and also comparison to the free or unmodified nanoparticle. So this result might be derived from covered by PAV by negative charge of extracellular polymeric substances of biofilm matrix. So we move to the next slide. So we also investigated about the enzymatic degradation of the PAV-PP nanoparticles by isolated phosphatase. So in these studies, our modified nanoparticles, basically we incubated with the isolate alkaline phosphatase, and then a release of monophosphate were determined by malahide green assay in a time-dependent manner. So as you can see in the figures, higher amount of the monophosphate was released from the modified nanoparticles because as a response for the ILP triggers enzyme. So if you see unmodified, I mean, treated in the same condition, I mean, almost minor phosphate release from controls. Then we can move to the next slide about the CIF and zeta potential during enzymatic degradation. So in these studies, we confirm that enzyme can cleave off the PP from the PIV polyphosphate nanoparticles. So that's why we see the changes in zeta potential. So as you can see here, after 24 hours, the zeta potential of PIV PP nanoparticles rise up from negative, as you can see here, around -7 to almost neutrals. Let's see, yes, almost neutrals. Then perhaps this around delta 10.4 millivolt because of the ILP dependent of cleave of polyphosphate from the surface of this particle by the shielding effect of the cationic PAV. On the other hand, as you can see, particle incubated in the absence of the enzyme, as you can see, no significant shift in zeta potentials. So then after, we also evaluating about the extracellular phosphate activity in Candida albicans. So in this case, we utilize paranitrophenyl phosphate as a substrate for phosphatase, as you can see in the figures, in a time-dependent manner up to 24 hours, increasing absorbance in 405 nanometers when paranitrophenol phosphate incubated with the viable intake of the Candida albicans. So it means that indicating the high extracellular phosphatase activities in. So when, as you can see, when Candida albicans was incubated with paranitrophenol phosphate in the presence of the PIC, phosphate inhibitor cocktails, so we inhibit the activity of phosphatase in Candida albicans by adding the phosphate inhibitor cocktail. As you can see, only minor absorbance increase. So according to these results, confirmed that formation of the paranitроphenols was dependent on the Candida albicans derived phosphatase, because we know, as already mentioned before, in the Candida albicans in there also have activities of the phosphatase. So, and also we evaluation about extracellular phosphatase activity in the Candida albicans, and yeah, it seems like malahide green assay, or we call it the malahide green calorimetric reagent we put in to evaluate them. So as you can see, a pronounced increase, and also even free phosphate was observed when the different concentrations, let's say like 312 and 156 microgram per milliliters of the PIV containing PIV PP nanoparticles when we incubated with the Candida albicans. So it's clearly saw the concentration of the, how can I say, free monophosphate was slightly increased, similar level when PIV polyphosphate having final concentration 78 to 19.5 microgram per milliliter PIV were incubated with the Candida albicans. So it means that, or we can explain by the comparative lower amounts of the polyphosphate, and of course, consequently also lower amount of availability about the terminal phosphate that can be cleaved off by extracellular phosphatase. So in the end, we also determine the killing efficiency of the Candida albicans biofilms. So in the studies, we prepare PAV or PAV PP nanoparticle on, I remember Cecily Candida albicans perhaps, and dosarial diluted concentrations, and then we took a liquid, and then we extract out into the PDA. So you can see the colonies, and then we grow overnight, for instance, and then we counted the colonies. So as you can see in the figure 7, a significant decrease in surviving Candida albicans cells when PIV concentration was rise up to 312 microgram per milliliters. So it means that PIV PP nanoparticles can enhance antifungal activities against Candida albicans biofilms, then decreasing the survival of the pathogen. When you divide this, it's going to be 7-fold in comparison to the naked PAV. It means the unmodified nanoparticles. And then we move to the next slide. We also future investigate by confocal laser scanning. As you can see in the supporting figures, we utilize or we growing in the biofilm, and then we incubate it with the body P, label it with PAV, PP nanoparticle, with the concentration 312 microgram per milliliter, because as you can see in the previous slide, it can be have, or we can say that high activity. So as you can see, when you label it, your PAV polyphosphate nanoparticle, and then you incubate it with the candida albicans, as you can see, it is like channel 1 to channel 2, even also when we melt those are. So indicated that membrane can localize then an internalization of the PAV. So this result might be explained by the coating of PAV with the ionic components, for instance, polyphosphate of the biofilm on its way across to the extracellular biofilms matrix that limits the antimicrobial activity of these proteins. So this is the last slide. So let me sum up the points. So PAV, PP nanoparticles can be considered as a treatment for skin infection of the Candida albicans. So protecting effect of the polyphosphate coating might be enhanced the efficacy of many agents because they can exhibit polycationic characters. So as a part of topical administration, this concept can describe or even work for parenteral administration antimicrobial drugs in the futures. So thank you very much. And then I will end this presentation.
Okay, thank you very much, Mr. Apotheker Ahmad Saleh MPH, for giving us such informative, full insight and interesting presentation about a game-changing approach for the delivery of antifungal proteins, HIP or COP. So, ladies and gentlemen, now come to the question and answer session. I'd like to have 1 or 2 questions from the participants to our speakers, please. Thank you for the insightful presentation, Mr. Ahmad Saleh. We will now proceed to the Q&A session. Participants are welcome to raise their hands using the raise hand feature in Zoom to ask question directly. Please ensure your microphone and camera are unmuted when it's your turn to speak. Alternatively, you may type your question in the Zoom chat room. Kindly include your name and specify to whom your question is addressed. Mr. Ahmad Saleh and ladies and gentlemen, I have already had 1 question from Mr. Muhammad Isrul, asked about how does the enzymatic degradation of PP nanoparticles by alkaline phosphatase influence the zeta potential, and why is this significant for antifungal drug delivery?
Okay, can I answer?
Yes.
Okay, so as I mentioned before, our PAV PP nanoparticles has, let's say, we already modified. So because we know that PAV have the positive charge when you incorporate it with the polyphosphate, so it's going to be negative recharge in the surface. So if those are cleaved by alkaline phosphatase, you can see release of the polyphosphate by evaluated with the malahydrin assay. So if you see the release of monophosphate, it's automatically clear that can shifting the zeta potential, for instance, from negative charge because polyphosphate has a negative charge, and then you can cleave by enzyme, then it can be positive again. So it means can it means that enzyme degradation happens in our nanocarrier systems. So anything else?
Yeah. Yeah. Enough, Mr. Ahmad Saleh. But I have question too. What is the polycation dilemma, and what strategies are proposed to overcome it?
Okay, you mean the polycationic dilemma, right?
Yeah. What is the polycation dilemma, and what the strategies are proposed to overcome it?
Yeah. So basically, we need the cationic nanocarriers, the cationic substrates. I mean, but these carriers have the positive charge, and then we know that we cannot passing easily mucous barriers, for instance, or even those barriers in our body. So that's way. But initially, we need the positive charge to uptake in the membrane. So, for instance, but on the way we cannot reach them. I mean, it's not sufficient. That's why we are coated with the negative, for instance, polyphosphate or the biorenewables have the negative recharge. So that's why we can face or we can tackle the polycationic dilemma in our body. So I think like that.
Yeah. Thank you for your answer, Mr. Ahmad Saleh. So, ladies and gentlemen and honored guests, thank you very much, Mr. Ahmad Saleh, for your insightful and inspiring presentation today. We deeply appreciate the time, knowledge, and perspective you have shared with us. Hopefully, the knowledge imparted will be greatly beneficial to all of us. And see you again in the future. And once again,
Sorry, maybe Dr. Muammar Fawaz have a question for me.
Oh, yeah.
He already raised hand in the apps.
Raise hand?
Yes, I saw Dr. Fawaz there.
Yeah.
Oh, yeah. Okay. I'm sorry, I don't see it.
Thank you so much for this opportunity. Nice to meet you, Mr. Ahmad Saleh. I'm pleased to be here today. I think that this meeting could enrich our knowledge regarding the drug delivery system, especially in mucus. Based on my experience about the enhancing the drug penetration, do you have experience about the pharmacokinetic profile after modification of the drug, such as using PP technology or something else? Because we know that when we increase the drug affinity, it could be influence the pharmacokinetic of the drug. As a result, the time of the drug bind the blood protein will be longer than before, and it could be become a toxic of the body. Maybe you have insight about that. Thank you.
Okay, thank you so much for interesting questions. So basically, in our works, we're working with what can I say, the polymers or modified polymers as we know, for instance, in my cases, we utilize, how can I say, biodegradable auxiliary agents like polyphosphate, and also already mentioned by Food Drug Association, FDA, even also World Health Organizations. It means that, I mean, it's safe as we know. So about the pharmacokinetic. So until now, I'm sorry, and I don't know what about that, but I had something. They also measure about the pharmacokinetic, for instance, in some animals. But as I know, or as I'm a PhD student, I never worked with that. But we can also, for of course, to investigate them. So only this I can answer, Dr. Faust.
Thank you so much for this nice presentation.
Thank you so much for your question, Mr. Muammar Fawaz, PhD. So, as a token of our appreciation for Mr. Ahmad Saleh contribution to this seminar, we are honored to present you with us with this certificate of appreciation. Okay.
Thank you so much.
Thank you. Thank you for sharing your knowledge and insight, Mr. Ahmad Saleh. Hopefully, the knowledge imparted will be greatly beneficial to all of us. And see you again. See you again in the future and once again in Indonesia too. Yeah. Thank you,
I
Mr.
hope
Ahmad
so
Saleh.
soon.
Yeah. Ladies and gentlemen, we have reached the end of today's program. Thank you for your active participation and valuable contribution. We hope the seminar has enriched your understanding of natural and phytopharmaceutical technologies. Have a wonderful day, and we look forward to welcoming you to our future events. I now hand the event back to the Master of Ceremony. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Manusia dilahirkan berbeda-beda. Ada yang tinggi, ada yang bermata biru, ada yang rambut ikal, ada yang berkulit putih. Demikian juga dengan penyakit. Bahkan pada anak kembar pun penyakitnya berbeda. Contohnya, ada yang punya penyakit jantung, hipertensi, diabetes, penyakit imun, bahkan kanker. Mengapa demikian? Susunan DNA pada manusia tidak ada yang sama. Kita memiliki perbedaan 0,01%. Tubuh manusia terdiri dari 100 triliun sel. Setiap sel memiliki inti sel, kecuali sel darah merah. Setiap inti sel memiliki 46 kromosom. Sepasang kromosom berasal satu dari ayah dan satu dari ibu. Kromosom adalah gulungan rantai panjang DNA. Gen adalah potongan dari untaian panjang DNA yang menjadi protein tertentu. Protein berperan dalam berbagai macam fungsi tubuh. Lalu, apa perbedaan antara gen dan genom? Gen dianalogikan seperti satu resep masakan. Sedangkan genom seperti satu buku resep lengkap. 0,01% perbedaan tersebut diibaratkan kalau terjadinya typo pada susunan DNA manusia akan menyebabkan perbedaan protein yang dihasilkan. Perbedaan susunan basa DNA itu disebut dengan single nucleotide polymorphism atau SNP. Perbedaan SNP ini bisa menghasilkan protein yang berbeda, sehingga muncul fenotip yang berbeda. Fenotip adalah ekspresi dari gen yang bisa dilihat seperti tinggi badan, warna mata, warna kulit, jenis rambut, bahkan resiko penyakit. Jadi, selain lingkungan, makanan, usia, gen memegang peranan penting. Dengan mengetahui informasi tentang genom tubuh, ini dapat membantu menjaga kesehatan secara personal.
Menuju era digitalisasi, Bank Songka terus maju dengan berinovasi menghadirkan ekosistem digital transaksi pembayaran elektronik perbankan dengan mempersembahkan fitur baru, Beski, Bank Sultra Greece melalui aplikasi Bank Sultra Mobile. Kini ada cara yang lebih mudah liburan bareng teman. Meski nggak perlu khawatir lagi dengan banyaknya uang cash yang dibawa. Mau bayar apa saja, tinggal scan. Dengan kris Bank Sultra, urusan beres, liburan pun jadi lebih nyaman. Meski nggak perlu panik kalau belum tarik tunai. Tinggal scan dengan kris Bank Sultra, pembayaran jadi lebih mudah. Mau tampil cantik dan terlihat kekinian? Tinggal scan buat Beski jadi lebih pede. Mau kulineran? Beski nggak perlu keluarin dompet lagi. Bayar makanan jadi lebih higienis. Beli pakaian gak ribet lagi. Bayarnya tinggal scan. Pedagang pun tidak perlu repot mencari uang kembalian. Beli perhiasan jadi lebih aman. Gak perlu bawa uang cash, tinggal scan dan semuanya beres. Beli hasil kerajinan tenun jadi lebih nyaman. Pedagang pun tidak perlu takut lagi dengan uang palsu. Mau belanja? Cukup nenteng keranjang saja. Jadi lebih praktis tanpa harus bawa dompet. Belanja apapun, dimanapun, dan kapanpun, lebih mudah, lebih cepat. Gunakanlah kris Bank Sultra melalui Bank Sultra Mobile. Dari Bank Sultra, maju bersama.
Ladies and gentlemen, may I have your attention, please? The conference will begin shortly. Thank you for preparing yourselves to join our virtual conference. Please make yourself comfortable. Thank you very much for joining our conference. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon to everyone and good morning for Professor Simon Moser in Austria. Nice to meet you. Prof.
Nice to meet you.
Okay. Respectable founders of Mandala Waluya University, Honorable Rector of Mandala Waluya University, represented by the Vice Rector 3 for Cooperation and Student Affairs, Mr. Toto Suryanto MHKS. Honorable Dean of Faculty of Science and Technology, Dr. Sri Anggarini Rashid, MSc. Honorable Chairman of Department of Pharmacy, Faculty of Science and Technology, Dr. Apotekar Musifaya, MSc. Dear Pharmacy Department lecturers and honorable participants of the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice. And I would also like to extend my respect to our keynote speaker, Prof. Dr. Simon Moser. On behalf of the organizing committee, I am delighted to welcome all of you to the 4th Mandala Waluya International Conference on Pharmaceutical Science and Practice with the theme Innovation and Future Trends in Natural and Phytopharmaceutical Technologies. It is an honor for me, Selvi Rahmawati Saranani, to serve as your moderator for this esteemed event. Today, we have the privilege of hearing from our distinguished keynote speaker, Professor Dr. Simon Moser from the University of Innsbruck. Before we begin, let me briefly explain the structure of today's program. We will start with the keynote speech, followed by a Q&A session. And for our virtual attendees, please feel free to use the chat box to send in your question. It is a great honor to introduce our keynote speaker, Professor Dr. Simon Moser from the University of Innsbruck. Prof. Moser is a renowned expert in pharmacognosy, and we are excited to have her here with us today to share her insight on pilobilins about an emerging natural product class and its relevance in pharmacognosy. Let us warmly welcome Professor Dr. Simon Moser. Now, to provide a better understanding of our speaker's background and remarkable achievements, allow me to present her curriculum vitae. This will highlight her expertise and significant contribution in the field of natural and phytopharmaceutical technologies. Prof. Moser, can you hear me?
Yes, I can hear you very well.
Yeah, your voice is clearly.
Can you hear me?
Yeah, I can hear you. Your voice is clear. Okay, I wanna read your curriculum vitae. Yeah, Prof. Dr. Simon Moser, expert in natural products and pharmaceutical science, professor and head of pharmacognosy in University of Innsbruck, Austria. The profile, Prof. Simon Moser studied chemistry at the University of Innsbruck, Austria. She also earned her doctorate at the Institute of Organic Chemistry with research focus on new natural products derived from chlorophyll degradation. Her work was honored with the Best Student Paper Award from the University of Innsbruck and the prize for the Best Dissertation of 2009 from the Austrian Society of Chemists. She was awarded the Blair Curtius Plederer Watcher Prize for Pteridinology in Innsbruck in 2020, and the Dr. Wilmar Squibb Prize awarded by the Research Society of Medicinal Plants and Natural Products. He established a research group when he was chair of pharmaceutical biology at MU Munich. He has also served as a guest lecturer at the University of Vienna and PMU Salzburg. In her research, Simon Moser and her team focus on engaging in drug research based on newly discovered natural materials. The spectrum of her methods range from analytical profiling of natural sources to cellular screening for potential protein targets. The central question in her research is, do aging processes in medicinal plants provide opportunities for research in the field of natural products? Inspired by the breakdown of chlorophyll, which is the prototype of the aging process in plants, he wanted to take a closer look at aged plant material under stress. For example, due to change in environmental conditions. The idea was to use this material to identify new natural substances, to elucidate their structure and bioactivity, and to investigate their mechanism of action in human cell. By discovering the first human targets of chlorophyll catabolites, the cellular cytoskeletal proteins actin, Simon Moser's team has made important progress in the understanding of the importance of the breakdown products of chlorophyll, one of the most important pigments on Earth. She wants to use these findings and explore the potential of aging products from plants as primary structures for existing therapeutic application. And her publication, 2024 special issue Judith M. Rollinger, and the title Structural Characterization and Antioxidative and Anti-Inflammatory Activities of Phylloxanthibulins in Trapoiolum maius, and etc. Experience teaching, Pharmacy Lecture Series, Bachelor of Pharmacy Thesis, Pharmaceutical Research in Industry, Biogenic Medicines, New Research Result, Pharmacognosy, Analysis of Current Research Data, and Discussion of Current Research Data. Okay. And so, Prof. Moser, nice to meet you for today. And Prof. Moser, the virtual stage is yours. We are keen to learn from your expertise. Please go ahead.
Thank you for the kind introduction, and thank you for the invitation to present my research here. It's an honor. I will just share my screen. You should see the PowerPoint by now. And you cannot see the presentation. Wait a second. Just 1 second, my apologies. Might should work. Now you should see the full presentation. Okay. If there's any technical issue, please just interrupt me. Otherwise, I would just start. So as the moderator kindly introduced, I am working on a plant natural product family, which are called phyllobillins. And phyllobillins are related to chlorophyll and its degradation. So you all know chlorophyll, the green plant pigment, is degraded regularly, and at least in the northern hemisphere, it's also degraded in autumn. And this is what we see then. So chlorophyll, the green vanishes, and you get these nice yellow colors of the leaves. But how is this important for, how is plant senescence important for natural product chemistry? I just want to give you one example, and this is red wine leaves. So red wine or grapevine leaves, which has been the medicinal plant here of the year 2023, from the grapevine Vitis vinifera. There's a special variety, the Dyer's grape or Teinturier, It's a variety that forms red leaves in autumn. And this is used as a herbal medicine for chronic venous insufficiency. And the color comes from anthocyanins, but relevant for the efficacy in CBI is not the color as was previously thought, but phenolic flavonoids, flavonoid glucosides like camphorol, glucoside, isoquercetin, and so on. So you can see the structures down there. And what is important here, and what I'm getting at, is that these compounds, their quantity increases during the senescence of the plant. So the herbal remedy is harvested after the grapevine harvest, which is used, of course, for fermenting and making wine for drinking. But the leaves are harvested afterwards, so there's a dual use of the grapevine. And only after the contents of these compounds is high enough to be used as a herbal remedy. So the harvest takes place 2 to 8 weeks after the vintage, and the pharmaceutically relevant phytochemicals are only at a higher quantity during and after the ripening of the grapes. So the expert eye has already seen immediately that the picture I'm showing you to the left here is not grapevine anymore, but is Boston ivy or Parthenopsis. And we use that because it grows next to our university. It's not really closely related to wine, and it's often confused for it, but it also makes this nice red color. So we sampled it. So we collected it in October 2 years ago, and we took samples of a yellow and of a red leaf. And what you see to the red is an HPLC trace. Black for the yellow extract and red for the red one. And you can already see here that there are huge differences in the profile. So the phytochemical composition changes during the senescence process. We identified one of the compounds by using a reference standard as isoquercetin, so one of the important chemicals in grapevine. So autumn colors are the great characteristic signs of plant aging or leaf yellowing. For example, here this picture taken from outer space, so you can even see that from outer space. But what was extraordinary about that is that the color responsible for that, or the molecule behind it, chlorophyll, gets degraded then, and it's not exactly known what happens to it. So despite this being the most visible sign of life on Earth, even observable from outer space, and the sheer amounts of chlorophyll that get degraded every year on Earth, it seemed to disappear without leaving a trace for a very long time. And it took until the very late 90s until the first compound that's related to these colors that we see was identified. And luckily enough, nowadays we know what's hiding in there. And it's a compound class that we now call phylobilins. And we call them phylobilins because to the relation of chlorophyll to heme, and the iron contained in porphyrin in our red blood cells. And the degradation products from heme are called bilins, and now the bilins from plant are called phylobilins. In the meantime, the degradation pathway has been clarified with a few open questions, but I don't want to go into detail here. You can just see that it's a long, multi-step process that is strictly controlled in all higher plants investigated so far. And it takes place in the chloroplasts up to the stage of a so-called 3,2-hydroxy-PFCC that you can see here, the right bottom. And then it gets exported from the chloroplast, and here's where it gets interesting, because here we can see differences depending on the plant species. So this biochemical pathway is now called the PAO phylobilin pathway. So after the phylobilins, the product is produces, and the PAO, the enzyme, you can see here, it's the key enzyme that cleaves open the macrocycle. So as end products at the time, the phyloleucobilins were known. So leuco from colorless. So colorless open linear tetrapyrals accumulate at the end of this process. And I actually just want to go back to my PhD thesis to show you how this took a detour. So the aim of my PhD thesis, the original one, was to find whether chlorophyll breakdown proceeds further beyond the stage of these colorless compounds and produces yellow compounds contributing to the colors we see in autumn. So does this pathway go any further? And the answer is yes, it does. So the pathway produces also phylloxanthophyllin, which gets important later on. So remember the structure, which has a double bond here, where the colorless one doesn't have one. And when looking for it, we can also find it naturally in leaves. And we then looked for sources of this compound in other plants and also in fruits, because we wanted to be independent of the autumn harvest of the seasons. We wanted to have something that we can access all year long. And when I started in the lab of Professor Kreutler, my PhD thesis, they could show that chlorophyll breakdown, so the disappearance of the green color, yields the same compounds in senescence, so during the aging process in plants, but also during the ripening process. So you can find those compounds also in apples and pears. So I wanted to investigate something yellow, which we can buy in the supermarket all year long, and I chose the banana. And here's when it became interesting. So apples contain the phylloleucobilins, the colorless phyllobillins, but bananas, we found that they contain phyllolumibilins. So phyllolumibilins, I didn't go into that, are the precursors of the phylloLeucobilins, which are usually not stable in plants and get converted to the phylloLeucobilins just by a lower pH in the vacuoles. But here, the bananas contains fluorescent, so lumi comes from fluorescent phyllobilins. So we asked ourselves whether the bananas are fluorescent too, and yes, they are. There's a blue fluorescence coming from those. And we identified the compound for that, and we called it a hypermodified phyllolumibilin, which you can see here on the right, because it has this esterification here at the side chain. And this also explained the stability, because this esterification is needed, or this free propionic acid side chain is needed to convert the phyllolumibilin to the colorless compound. And you can also see that these compounds accumulate during the storage in parallel to the fluorescence. So there is a correlation. And it became even more interesting. You all know that when a banana gets even riper, it has the senescence-associated spots, that when you look under the scanning electron microscope, you can see that these cells have lost their turgor, and around the spots, the cells are still healthy. And if you look at those bananas in the UV light, you can see that these blue fluorescent rings around them. So we isolated this compound as well, and we could show that like the background phyllolumibilins is the one I've shown you, and the one in the rings has this additional glycosyl unit. So this is prevalent in the rings. So we don't know what this is for. So what is the role of this PLOPS? So we wanted to investigate it further and did a surface scan of a banana with a fluorescence probe. And we could really nicely see a so-called, we called it a volcano plot, a fluorescent ring or high fluorescence intensity around the brown spots. And now with this, we could do a time lapse, and you can see that the spots appear and disappear in the course of 24 hours. And this was a student project to investigate and make a video out of that. And I'm showing that if it works. Oh, it doesn't. That was clear. So you would have been able to see the spots appear and disappear again under UV light. But if you want to watch this video, there's a YouTube link. You can have a look at it. So why are these PLOPs accumulating? So when we published that, it went through the press, and there were some speculations what they were good for. Like the National Geographic News said, the glowing spots reveal how cells die, or they are the blue halos of doom, or the this is from the telegraph, that bananas turn bright blue under ultraviolet light, helping animals pick right ones, or that they attract monkeys. Actually, we don't know the role of the phytolumulins. What are they for? What does the plant make them for? So chlorophyll breakdown is usually seen as a detoxification process. In autumn, when chlorophyll is no longer needed, the proteins around it get degraded, and free chlorophyll is phototoxic and has to be destroyed. And the plant achieves that in this multi-process or multi-step process by making the phytoleucobilins or PLEP. But then we have this high diversity. So we have over 70 different structures of phylobilins identified until now, and we're still counting. And also, there are these colored phylobilins. So there's phyloxanthophyllin, the yellow one, and phylloroseobilin. So these are pigment, and they now seem to revert all these efforts of chlorophyll breakdown again, because they are again less polar. So it goes in this direction again for the polarity, and they are again pigments. So from the colorless PLEP to the yellow PXB and the pink phylloroseobilin. So when I started my lab in Munich, where I started my group leader career, our aim was to not see chlorophyll breakdown as a detoxification process, but to see it as a source of bioactive compounds. So we set out to isolate these compounds and to do biological assays for that. And I just want to give you two examples. One of them is echinacea. So the purple cornflowers, there are more than 800 echinacea-containing drugs on the market alone in Germany. And it's the best-selling herbal product in natural food stores in the US. When we looked at echinacea, we were quite surprised because we found an unprecedented abundance and diversity of phyloxanthophyllins in the extracts. And you can see here leaves of different colors, and we made the extracts and analyzed them. And you can find all signals for 6 phyloxanthophyllins in all of the extracts, even in the green leaf, where there's no visible chlorophyll breakdown yet. So we isolated all 6 of them and elucidated their structure. And you can see a nice polarity spectrum. So they differ in the residues on the side chains here and here. Having that, we looked at the assessment report of the EMA, so the European Medicines Agency, for the pharmacological effects of echinacea. It's well known to have immunomodulatory effects, anti-inflammatory effects, and antioxidative effects, which are mostly attributed to caffeic acid and its derivatives. So these are quite well established, but when you look at the overall conclusions of non-clinical data, the EMA says that the mechanisms by which the clinical effects are achieved is not known. So the relevance of these findings cannot be assessed because the active compounds for the effects still remain to be elucidated. So we thought, what about the phylobilins? Because we see a high abundance of them in echinacea extracts. So we looked at antioxidative activity in vitro, and you can see that the phyloxanthophyllins from echinacea are very potent antioxidants, comparable or even better to caffeic acid, so an established antioxidant from echinacea. Also intracellularly, there's a strong antioxidative activity comparable to caffeic acid, and we also could see by assessing glutathione levels that the phyloxanthophyllins can protect the cells from oxidative stress. So here we have interesting compounds, and we looked further. Since they are water soluble, we looked for them in teas. And in nettle tea, we found an interesting phyloxanthophyllin. Here you see the structure elucidation. So in nettle tea and in the nettle green leaf, you can see the signal from a phyloxanthophyllin. So it links on the left as the structure overlaid with the NMR data. So it's one that we can also find in echinacea. And again, we compared the antioxidative activity to compounds established in nettle as being potent antioxidants like chlorogenic acid and caffeic acid. And you can see that the phylloxanthophyllin from nettle is well in that range. Nettle is also appreciated for its anti-inflammatory properties. So we checked the inhibition of the central pro-inflammatory enzymes COX-1 and COX-2, and we could find that in an activity assay, the phylloxanthophyllin was able to inhibit COX-1 and COX-2, both in the micromolar range. We also checked expression levels of COX-2 by Western blot, and we can see that the phylloxanthophyllin changes or alters the impression levels of COX-2. So we looked further into the anti-inflammatory properties of these compounds. And for this, we looked at an enzyme which is important as key immunoregulatory enzyme in a PBMC model, so in peripheral blood mononuclear cells. So IDO1 indoleamine 2,3 dioxygenase, the enzyme that catalyzes the breakdown of tryptophan to kynurenine. And the activity is an important biomarker for immune-related processes. So it's upregulated in inflammatory conditions. And the step that I just showed you is the rate-limiting step in tryptophan degradation. And we could show, so you can assess the activity of IDO1 by measuring the tryptophan to kynurenine ratio, and that's what we did. And you can see that PXB clearly inhibits IDO1 activity. So back to nettle. Nettle, again, a medicinal plant of the year, in this case 2022. And there is a committee that decides on the medicinal plant. And in this case, in their assessment, this is in German, but they mentioned the phylloxanthophyllin, that was one of the selection criteria because it's a newly discovered compound in there. And what they also say that it has a great variability in its quantity, and this is true. So we looked at different teas and we quantified the compound in there. And we could find up to 100 micrograms of this compound per cup of tea. But where these differences in quantities come from, we don't know. Is it the age at harvest, the drying process, or the storage conditions? And this brings me to another aspect that phyllobillins are important here. So I've shown you two examples of medicinal plants, but the green and the senescence also happens in food, and especially in stored food, you know, when it's wilting and the green color is fading. And I guess this video is also not working. It is. I mean, you all know this is a lettuce, and in storage, it gets shrinky and chlorophyll degrades, and usually gets less appealing. And we've known before that the PA or phyllobillin pathway, so the biochemical pathway, also happens post-harvest. But we looked at that, and you can see that the phyllobillin contents of iceberg lettuce is increasing over time. So this was expected. And also that with the phyllobillin contents increasing, we tested the antioxidative activity. And this is maybe a bit counterintuitive, that the stored wrinkly one seems to have more antioxidative power than the fresh green one. And this is probably due to phyllobillins being strong antioxidants. And we thought that maybe with this, we can go into the direction of food waste, because among the reasons for food waste, there are often cosmetic issues like changes caused by aging. And at least in Europe, more than 50% of food waste is caused by the end consumer. And we thought that maybe because lettuce and like healthy greens are often consumed, not for their taste, but for the health benefits. So we thought that maybe the knowledge about phyllobillins could have an effect on food waste. So we teamed up with the chair of marketing and consumer research at the Technical University of Munich, who conducted an online survey with more than 1,000 participants. And indeed, when you educate people about phyllobillins or consumers, the willingness to consume the lettuce is increased over time. Also, the health and the safety perception is increased of stored produce. So informing or educating consumers leads to a longer willingness to consume the stored lettuce and to a higher health and safety perception. So maybe with this research, and this is something that one co-worker of mine pursues or continues, maybe with this research we have the potential to reduce food waste. So I hope I could show you that phylobilins have become more and more important. And in order to have a tool for the community to analyze phylobilins in extracts and in plants, we've established a spectral database, which you can find free of charge on photochemcat.com, where you can access all the UV and fluorescent spectra, because they are very characteristic for phylobilins, and it helps to identify them in HPLC traces of extracts. Now back to the story at the beginning, the Parthenosis, if you remember, the wild wine, where the profile changes when the color changes. And these two leaves, if you remember, were harvested on the same day. So you can see one peak here that decreases when the color changes from yellow to red. And non-surprisingly, this is a phyloxanthophyllin, so a yellow-colored phylobilin. And together with the research center Leinburg in Italy, we are now looking into that further. So, but what I want to tell you in the last, in the next topic I want to address is now going deeper into the bioactivities of phylobilins. And we've looked at we wanted to look at the anti-cancer activities of phylobilins. And for this, we chose the Kotsura tree, Sucercidiphyllum. The reason for that was that it produces mainly one phyloleucobilin, so one colorless one and one phyloxanthophyllin, not like Echinacea, which produces 6 different ones. And those two have a very simple structure, so no modifications. And this makes it easier to isolate enough material for biological studies. So this is the botanical garden in Munich, and you can see the location of the trees pop up. They have a very nice app. And this is where we went every autumn to collect the leaves for our studies. So these are our yearly excursions. And it actually took us 2 years until we find out that the plane tree or sycamore tree right in front of our building, so the labs were located in this building to the left, has a very similar phylobilin spectrum. So the botanical garden is like 30 to 45 minutes of drive away, and we had the tree right before our noses. Anyway, so in the plane tree, we found again the same profile of one phyloleucobilin, just a difference at the stereocenter, and one phyloxanthophyllin. So all the stories I've shown you, the plants contain phyloxanthophyllins. So we thought maybe these are more abundant than previously thought. So they were discovered much later than the phyloleucobilins. But for this, we then perform paper spray MS, where you wrap a leaf directly around the filter paper, and then you can place this in front of an ESI source. With this, we could show that in all plants that we then investigated, we could also find the phyloxanthophyllin. So this is spinach, and this is the peace lily. And these are the two sources, Sucercidiphyllum and plain, that I just showed you. So we then tested the effects of on cancer cells, and we could see while the colorless one had no activity on the proliferation of T24, so bladder cancer cells, and MDA MB231, so breast cancer cells, the phyloxanthophyllin had a potent activity with an IC50 in the low micromolar range. We also could show that it inhibits clonogenic growth, so long-term growth of the short-term exposure, and we could also show that it induces apoptosis. So the yellow one, the phyloxanthophyllin, shows potent effects on cancer cells. We then thought maybe, is it polarity, or is it the structure that influences these activities? Because phyloxanthophyllin and phyloleucobilins, if you remember, differ only by one double bond. So what we did is a really straightforward medicinal chemistry approach where we made esters of these compounds to decrease the polarity. So we made methyl, ethyl, butyl, and octyl esters. And you can see this nicely works. So you get much less polar compounds. And we then tested those, and you can see that with decrease in polarity, you get an activity even of the phylloleucobilins. But still, yeah, exactly. We then tested the uptake and into cells. And you can see that the PXB and the phylloleucobilin, it's difficult to see here, but believe me, those are both getting taken up. It's just that we had to increase the scale a lot because the esters are taking up much more compared to the unmodified compounds. Anyway, if you look at the activity, the PXB still appears to be more potent compared to the phylloleucobilins. So if we sum up the bioactivities that we've investigated so far, like antioxidative, anti-inflammatory, and anti-proliferative, we can always say that yellow beats colorless. So the phylloxanthopilins seem to be more potent than the phylloleucobilins. And in this review article, which is unfortunately in German, we even say the more colorful, the more bioactive. Why do we say that? If you remember, there is a third compound, a phylloxanthopilin, so a pink-colored pigment coming from chlorophyll breakdown. And when you look at this one, and here we look at the anti-migratory activity on cancer cells, this is a wound healing assay or a scratch assay where you scratch a gap into a layer of confluent cells, and then you monitor the closure. And you can see that phylloxanthopilin inhibits the migration of cancer cells in the micromolar range, but the phylloxanthopilin even in the nanomolar range. So if you remember why these compounds are called phyllobilins, it's because they are structurally related to bilins derived from heme, so to biliverdin and bilirubin, which come from heme degradation. And so we looked at those two, and we could see that also bilirubin and biliverdin inhibit the migration of cancer cells, although at a higher concentration, which is needed for the effects to be seen. So phyllobilins and bilins inhibit cancer cell migration. That was already a result. So the migration of cancer cells is largely dependent on the cytoskeleton. So here, what we did, you can see again bladder cancer cell line and HeLa cancer cells. We stained F-actin in red, and you can see as a control the nucleus stained in blue. And when we treat those cells with phylloxanthopilin, you can see that it leads to this agglomeration of the actin filaments. And this is even more pronounced at lower concentrations for the phylloxanthopilin. So phyllobilins induce actin agglomeration. So you're well aware that the actin cytoskeleton is a dynamic feature. So there's a constant polymerization and depolymerization going on. So we looked at that in vitro using pyrene-labeled actin, and you can see that all 4 bilins tested, so we also tested the heme-derived bilins, decreased the polymerization rate and led to a lower plateau of fluorescence. And the same is true for the depolymerization. So the bilins accelerate the depolymerization, and here we compared it to the known actin depolymerized electron B, another natural product. And using turf microscopy, we could see that actually the nucleation is inhibited, which is the first association of monomeric actin. And we could see that all 4 bilins were able to inhibit the nucleation of actin for polymerization. So with this, we found that the phyllobilins and bilins have an impact on actin dynamics and act as actin destabilizers. And we then wanted to know whether this effect was direct, like by a direct interaction between actin and the bilins, or an indirect effect. And for this, we performed affinity chromatography using G-actin beads. Here we could see that all 4 compounds that we tested were able to directly bind to actin. We then had help from Ryan Pemberton and Denzel Burnett from Atomwise Inc. And they modeled the bilins into the binding site. And we could see that all 4 bilins occupy the same binding site. And it's the one of cobiramide C, also a known actin polymerization inhibitor. Knowing the binding site, we went back to affinity chromatography. And here we did a competition assay with profilin. So profilin is an actin binding protein that binds exactly to this binding site we found by in silico prediction. And we can see that all 4 bilins can compete with profilin for this binding site. Last but not least, we tried to get the KD values, so the binding affinity by different biophysical methods. And you can see that we get different KD values for the 4 bilins, and it is in parallel with the biological activity that the phyllorosibilin has the highest affinity. So phylobilins and heme-derived bilins bind to G-actin. They share a common binding mode with cobiramide C, and phyllorosibilin, the pink pigment, shows the strongest binding affinity to G-actin. So these results were quite new. So tetrapyrrolic pigments are actin-targeting compounds. So phylobilins and heme-derived bilins inhibit cancer cell migration and actin dynamics. And the cytoskeletal protein actin is the first identified target for the phylobilins and one of the few identified targets for the heme-derived bilins. So knowing this, we went further into target identification. I won't go into detail here, but here, so for the mode of action, in order for a molecule to become a drug lead, we need the mode of action. And it's either the binding to a direct target. And here, we could get it from the observed effect that cancer cell migration is inhibited. And you can also look at the pathways and networks that are affected. And for this, we used affinity chromatography, so where we use mass spectrometry to identify proteins that have been pulled out by using the compound on beads or on an immobile phase. And we did that by coupling the phylloxanthopylin via a PEG linker to biotin and using streptavidin beads together with Dr. Fröhlich from the Gene Center at the LMU Munich. And we are currently confirming the hits. But what we are mostly doing in addition to affinity chromatography is that we used a yeast-3 hybrid system, which allows for the detection of drug-protein interaction in living cells. The advantages of the yeast-3 hybrid system is that yeast is a eukaryote, so we can use eukaryotic cells, and it uses cDNA, so we don't need high quantities of purified proteins, and we can also identify weak and transient interactions. So we set up this the system in our lab, and we've already validated the system. I won't go into detail here, but we have different candidates now for screening. So this is just a little outline and a little cartoon how this yeast-3 hybrid works. We have a team at the Paracelsus Medicinal University of Salzburg that do the in silico confirmation of hits. And of course, we screened our phylloxanthopylins and we were able to identify 2 more targets. And I hope you can see more about that in the future. So these are currently being validated. So I hope that I could show you that senescence in medicinal plants is a chance and not only detrimental. And I hope I could show you that with the example of phylobilins, which is a family of natural products with high diversity. They are important phytochemicals that occur in medicinal plants. They possess pharmacologically relevant activities that we are investigating further. And also together in collaboration with the Research Center Leinburg in Italy. We are also performing in vivo studies together with the Johannes Kepler University in Linz, Austria. And Professor Lindsay is attempting the total synthesis and also in vivo studies with radio-labeled probes at NC State in the US. I could also show you that both phylobilins and bilins bind to actin and inhibits its polymerization. So we have actin as the first described target, and we want to get further into target identification, and this is where we set up the C3 hybrid system. And here we have now a long list of collaborators for the E3 hybrid system. So this was all about Munich. I recently moved to Innsbruck in Austria, where we also can see some really nice fall colors. And here, pharmacognosy, I don't need to tell you this, is a multifaceted science with a focus on natural compounds. So in Innsbruck, what we want to do is that we want to find new organisms, new structures. So we identify compounds, we isolate them. We do a lot of analytical studies, but we also want to use them as a new tool for studying cell death mechanism and for identifying new relevant targets. And maybe then, together with collaborators, we can find new drug leads for the future. So I'm already at the acknowledgements. I especially want to thank my advisor in Munich, Professor Vollmer, and my small team in Munich. They have been absolutely great. And especially those two, Cornelia and Chris, they have moved me to Innsbruck, and this is now my team in Innsbruck. I'm very happy to be there and have this team of amazing scientists, and I'm really looking forward to the future. I thank you for your attention, and I'm happy to take your questions.
Okay. Thank you very much, Professor Dr. Simon Moser. This is amazing presentation. And thank you so much for giving us such an informative and interesting presentation. Your insights have been incredibly valuable. So, ladies and gentlemen, we now come to the question and answer session. We invite to you to ask your question directly to Prof. Dr. Simon Moser. You may raise your hand using the raise hand in feature in Zoom or type your question in the Zoom chat room. Please include your name and affiliation. So in chat room, we have two questions from Mr. Muhammad Isrul and his affiliation in University of Mandala Waluya. The question: how does the structural diversity of phylobilins influence their bioactive properties, and what implication does this have for their potential application in medicine? Prof. Moser, we would appreciate your thoughts on this question.
Okay, thank you for this question. Yes, that's a question that we cannot answer yet completely. So we've already seen that the chromophore plays a big role. So whether it's a phyloleucobilin, phylloxanthobulin, or phylloroseobilin, there's also further modifications to the chromophore that I haven't talked about. But we can see that this alters the potency, especially to the proliferation, anti-proliferative activity on cancer cells. We can also see that the peripheral modifications, so the polarity, as I've shown you later on in the talk, influences the cellular uptake and with it, of course, the activity. But so far, any structure-activity relationship studies that are systematic have not yet been performed for this class of compounds.
Okay, thank you. You're answering, Prof. Moser. Second one question from Wahada Siti Humaira. And the question, as we know, chlorophyll is one of the components that can interfere with the withdrawal of bioactive compounds from a plant, especially in leaves. Her question is, what method or solvent is good for removing chlorophyll from the natural compounds? Please go ahead.
Okay, so in our case, the phylobilins have such a different polarity that we use water. So we use hot water extraction or we use hydroalcoholic solvents. And if you use that, then you do not extract chlorophyll. And it's very easy to get rid of it if you use polar solvents. If your compound doesn't allow that, you have to use more apolar solvents. And then we found that you use column chromatography. So normal phase column chromatography can help to get rid of chlorophylls. But you need a purification step. But in our case, we are lucky we can use polar solvents, and then we don't have the chlorophyll problem.
Yeah. Thank you, Ms. Wahda Siti Humaira, for your question. And the last one question, Professor. The last one question. And in your opinion, how can the pharmaceutical industry better integrate findings from natural products research, particularly from plant-based aging processes?
How the pharmaceutical industry can exploit the findings? That was the question. Okay,
in your opinion?
In my opinion, I mean, you can see over the history of the last couple of 100 years that natural products are the most successful compounds for the pharmaceutical industry, and they still are. So the largest part of drugs that we have by now is still based on a natural product scaffold. And regarding the tetrapyrroles from plants, we are still at a very early development. So we first would need in vivo studies in order to see whether they are taken up. And we need some validation before this can be interesting for the industry, but we hope we can get there. And the advantage of this class of compound is that you have this large diversity occurring in potentially every medicinal plant, depending on the preparation. So there could be a huge advantage for some pharmaceutical industry, because you could use plants already on the market and enrich the phylobilin contents in there, for example. But there are still a long way till there.
Okay, thank you, Professor, from your answer for the all question. And Professor, as a token of our appreciation for your contribution to this seminar, we are honored to present you with this certificate of appreciation from our. Okay. Thank you for sharing your knowledge and insight, Professor.
Thank you so much for the invitation and for the discussion. It has been a pleasure.
Thank you so much, Professor, for your insightful and inspiring presentation today. We deeply appreciate the time, your knowledge, and perspective you have shared with us. Hopefully, the knowledge imparted will be greatly beneficial to all of us. See you again in the future, and once again, thank you so much. Ladies
Thank you very much.
You are welcome. Ladies and gentlemen, we have reached the end of today's program. Thank you for active participation and valuable contribution. We hope this seminar has enriched your understanding of natural and phytopharmaceutical technologies. Have a wonderful day, and we look forward to welcoming you to our future events. I now hand the event back to Master of Ceremonies. I am Selvi Rahmawati Saranani. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Well, ladies and gentlemen, that's all the second session of discussion seminar international today. Now we move in the next agenda is submission of the event to the presenter parallel session. The room will break out into 4 meeting room. And I want to inform to all participants, please come back again in the main room at 16:48 p.m. o'clock to join the announcement of best poster, best presenter, and there are some door prize sponsored by Prodia. Tes. Well, ladies and gentlemen, may I have your attention, please? Our ceremony will begin. Please have a nice seat and settle in your good position. Ladies and gentlemen, now we move on the next agenda. The next agenda is announcement about the best poster, the best oral presentation, and some announcement of the presenters that get a door prize sponsored by Prodia. The first, best poster of the Seminar International. The second runner-up, Syawal Abdurrahman. The first runner-up, Sedni Kuncoro. And the winner of the best poster is Haryana. Next announcement is the best of oral presentation. The second runner-up, Risma Yanti Fauzia. The first runner-up, Santi Sinala. And the winner of best oral presentation is Citra Anissa Dini Rusman Saputri. And for little information for you guys that the first of the winner, the best oral presentation and the best poster will get the door prize from Prodia. And then the next is some participant will active in the Seminar International will get the door prize. Those are, the first is Saudari Sultan. The second, Muhammad Ghazi. The third is Azara. The fourth is Muammar Fawaz. The fifth is Selvi Rahmawati. The sixth is Wahda Siti Humaira. The seventh is Muhammad Isfil. Oh, Muhammad Isrul. Well, ladies and gentlemen, for the last position to get a door prize, we will give opportunity for the committee that will come in this Seminar International to join a one quiz. The quiz is about one question. Terdapat satu pertanyaan untuk panitia yang disiapkan untuk mendapatkan door prize. Bagi panitia yang dapat menjawab pertanyaan akan diberikan hadiah. Pertanyaannya adalah, hadiahnya sponsor by Prodia. Baik, kita lanjut. Pertanyaannya adalah, nama pemeriksaan Prodia yang bermanfaat untuk mengetahui prediksi risiko penyakit, infeksi, dan kondisi kesehatan berdasarkan gen. Yang ingin menjawab silakan angkat tangan. Yang bisa menjawab silakan angkat tangan. Terdapat satu door prize disiapkan untuk panitia yang hadir hari ini. Kakaknya yang sebelah kanan ada? Yang di tengah? Yang di kiri? Oh, siapa tadi yang duluan? Siapa tadi yang duluan? Who is the first raise hand? You? Enda?
Jawabannya Prodia Nutrigenomics atau PNG. Prodia Nutrigenomics atau PNG.
Okay, good. The answer is right. Mau dikasih sekarang door prize-nya? Ladies and gentlemen, at the end of our international seminar today, we would like to say thank you so much for the honorable guests, moderators, and also all the participants that have joined until the end this event. We do apologize if there is any mistake and flaws in this event. Hopefully, we will take away the beneficial information and insight here. And in the last but not least, I close the session with wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. And see you again in the next seminar International Pharmaceutical Science and Technologies.